Not sure we can do it legally, but we're going to enforce the 120 thing, which is the fire marshal bill.
Okay.
So the police officer is checking the count.
Okay.
Again, I recommend you let the hospital folks talk first, and then
Right.
I would focus on the folks that are here. Right. I don't know if any of them are going to keep, but hopefully they will if they let them talk.
Okay.
I know Wade will leave. So I think he's the first one on.
Yeah,
so.
he is. Yeah.
And I don't
Kyle's
know.
right behind you. So.
Okay. And Alex the other agenda. So, but I would focus on the one today.
Yes, been on the phone a good bit. I've been reading emails and I work today. Yeah, I played that golf tournament.
You have another spot to sign. Want me to go back out and check in a few minutes? I know. Multitudinous law enforcement. Well, we've also got extra law.
Call the meeting to order. Start with roll call. Can you call the roll for me?
Yes. Commissioner Allen,
Present.
Commissioner Norwood,
Here.
Commissioner Ezell,
Here.
Commissioner Waddell,
Here.
Commissioner Stallings,
Here.
Commissioner Mason,
Here.
Mayor Pinkerton.
Here. Okay. All commissioners and the mayor are here. Let me start by talking about, there's a little confusion on.
Mayor, I'm sorry to jump in, but you might pull that mic closer because we're on Zoom too, and it might be hard to hear.
Okay, thank you. Let me start by saying there's a little confusion between, was the meetings at 5 or is it at 6:30? So I apologize for that confusion. I see a lot of the word got out. It seems like most people, there's enough people here to convince me that a lot of people got the word for 5 o'clock. So I apologize for the confusion on that. It kind of has to do with the routine. We usually have a study session at 5 and then a meeting at 6:30, so we just jumbled up the time. So I apologize for that. What we're going to do is listen to a couple of briefings early, and they're going to be fairly short, followed by everybody that signed up. We're going to take them in order. What I'm going to ask is that everybody that signed up is going to have 2 minutes to talk. I'll have a little timer going, so when you hear it beep.
The time, so I apologize for that.
Who's that?
Scott, can you?
There's still
mute
36
them?
people I'm trying to get on here, and everyone, I'm trying to unmute them, and
Okay,
so
that's fine.
I apologize.
Okay, it's okay. So when my alarm goes off, please take that as your hint that it's time to let the next person talk. In the interest of time, we'll stay as long as we need to stay. But if somebody has adequately covered the points that you want, there is absolutely nothing wrong with you saying, I know Pastor Burleson's talking first. So if you believe everything he said and you want to say, me too, I'm right on line with Pastor Burleson, he said what I wanted to say anyway, and take your seat. That'll speed things up a little bit. Same is true of any of the other speakers. So if somebody already made the points that you're wanting to make, and you feel like just saying, me too, that's perfectly acceptable. It's also acceptable after you speak if you wish to leave. It's not rude, it's not unkind. It's being considerate for the rest of the people in the room, so feel free to do that. You're not going to offend anybody by leaving. We try to keep 25 seats in here, and we've greatly exceeded that. The one thing we can't exceed is the fire department's capacity for the room. So if we get close to that, we're probably going to have to stop and not let anybody else in until somebody goes out. So that's kind of the rules for what's going to go on. Okay. Next up, item number 2, administration. Item number 2.1, discuss the COVID-19 pandemic and take necessary actions. And we will start with.
Mayor?
Yes.
Excuse my interruption.
Yes. May we start with a prayer and the Pledge of Allegiance? Okay, invocation by,
One of our first speakers, Pastor Burleson.
all right, would you do a sound?
Right?
Followed by a pledge from Commissioner Allen.
Right.
Thank you, Jerry.
Yeah, right.
All right, let's pray. Father, we come before you and we say thank you for the privilege of even calling you Father. I thank you for the men and women before us who represent our city, who lead us. Lord, I pray your blessing upon them, their families, their lives. Father, tonight I pray that we will have civil discourse. I pray that everyone in this room will speak as they feel led to speak, and will honor those who disagree, and will leave here not only better citizens, better countrymen, we'll leave here better people, because we have determined to stand on what we believe to be principle and love the people who live in this great country. We pray your blessings upon our country's leaders and upon this great nation. And it's in your precious and holy name, our Lord and Savior, Jesus Christ, we pray. Amen.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag Thanks, Commissioner Allen. I'm one of those guys that if I didn't see it written, I probably skipped over that point, and we should have had that included, so thank you for that.
Mr. Mayor, just a point, we don't normally put those on special meetings, but
Yeah.
or emergency meetings, but we will in the future.
Okay,
And
thank
we
you.
can put the pet on too if we'd like.
Okay, thank you. All right, medical folks, are they here?
I believe they're online. Scott, can you see if they're participating?
Maggie's on, Finney's on.
I think Maggie's going to be first.
She's up.
For all of the health providers, we do have a full room. We have a lot of people that want to speak. So we certainly want to hear what you have to say, but we'd like to hear it in kind of the Cliff's Notes version. So please go ahead with your presentation.
She's connecting.
Yeah, Mayor, you might just let everybody know you're on a weekly call
We have a lot of people that want to speak.
with Maggie and with
yeah.
Krista and Finney from the hospitals and other civic leaders. And so it's an opportunity for them to update the whole commission on what you get to hear at least once a week.
Right, yeah, that's true. So there's a lot of community leaders that have been getting together every week on that meeting. So not only looking at statistics, but also looking at the science and what's happening and how it's evolving and how it's moving through the country. So it's taking, we're spending a great deal of time to make sure that we all stay informed on that. So I think this is an opportunity for them to talk to you about some of the stuff that we've been hearing. Okay, Maggie, you ready?
Yes, can you hear me?
Yep.
It does say disabled screen sharing. Am I able to share my screen?
Doesn't look like it.
Okay, I'll do my best. I prepared a few slides. Good evening. My name is Maggie Jackson. I am the Community Engagement Director for an 8-county district of the Health Department. Garfield County is my home. Enid is my home. But I have been part of a team of first responders with the Health Department. And so first, just want to thank all of the nurses and wonderful staff who have been sacrificing so much in the last few months to serve our community in this pandemic response. I want to first say that I am this community means so much to me. I'm so honored to be a part of this conversation. I think that it's so important that we get to have these discussions. So I'm here representing the public health perspective, but I want to be here as a mom and as a member of the community, as your neighbor. I am paid by the county to protect your health, but I'm also a business owner, and I want to do my best to be a reliable source of information to you all. I want to try to answer questions, if we can, from our local public health agency, and do my best to give you a scenario of what is happening in Garfield County with COVID-19 with the data we have. So I can't share my slides, but I just want to remind everyone today we have 138 confirmed positive cases. We have 2 deaths, and we have 95 that are considered recovered. Today at the Garfield County Health Department, we had 200 people call and request a test. I've had some people ask us about the goal of large-scale testing, and the goal is meet the demand for people to want to know an answer of whether they're positive. Last week we did 400 tests on and through those tests, I don't have the exact number yet, but we've seen 20 to 30 positives come out of our testing. I wish I could show you my slide because my next one is the epidemiological curve for Garfield County. So it's available on the State Health Department website, but it shows the rate of increase in cases over time. So from March, beginning of March to June, beginning of June, we stayed at about 1 new case per day. There were a couple days it dropped, but we kind of had 1 new case would pop up every day. Around June 12th, we spiked to about 5 to 7 cases per day and then dropped back down. And now around July 13th, we are averaging about 5 new cases a day. So on the Coronavirus Health Department website, there's a new COVID alert system. This is giving a green, yellow, orange, or red indicator for the county status. The methodology of how they determine when a county is yellow, it has a lot of different factors that go into that. It's looking at the cases per 100,000 people. That's how we compare different population sizes. But you can access that yourself. I can't show you the image of that right now, but that's at the coronavirus.health.ok.gov. So please look at that if you're interested in seeing where we stand compared to other communities. Overall in Oklahoma, I can't tell you how many tests exactly have been done in Garfield County. I can tell you that across Oklahoma, 414,197 tests had been done by July 9th, and 21,345 were positive. So that's keeping us about 13% of our tests are confirmed positive. And this last week, we had 278 confirmed cases were reported to OSDH, people who were positive who were in the hospital. Overall in Oklahoma, we've had 1,893 people have been hospitalized with COVID-19, and currently about 487 are currently in hospitals across our state. Because of our small population size, I can't speak to our local hospitalizations, so I'm looking forward to hearing from our hospitals on what they're seeing every day at their offices. So I know we have a lot of conversation that's going to continue. I want to reiterate that today, for example, I received it's a morbidity and mortality week report from different research that's going across the country. And it's a really great image. I wish I could show you. I'll share it on our Garfield County Health Department page. It describes 2 hairstylists. So this is a business that was impacted by shutdowns, across the country. So these were 2 hairstylists that were positive for COVID-19. They spent at least 15 minutes with 139 clients. And the hairstylists and the clients also wore face coverings the whole time they were there, and nobody was infected with COVID-19. I want to reiterate a conversation tonight. I know a lot of people want to discuss the efficacy or the implication of face masks. Face masks reduce airborne and droplet transmission that leads to COVID-19. It is an effective way that we can prevent community spread. The Garfield County Health Department has always recommended face masks. I empathize with a lot of our community because information continues to, there have been changes in things we've heard. Honestly, I don't watch a lot of the news. I'm in the middle of it. So I'm listening to what our local data is saying. But for me, my directives and goals have changed daily sometimes. So my hope is that you can walk with me through data, understanding that this is a dynamic, changing situation that we have not encountered before. And it's such a difficult thing to give people a clear black and white message when you learn information every day. I'm learning every hour sometimes. So I hope that you see I'm in the middle of it, that I am learning every day new information. So for example, at the beginning of the response, we had a large shortage of N95 masks, and our healthcare providers were at risk of not being able to obtain an N95 to protect themselves doing their job on the front lines. This was the message for people to not purchase an N95 mask and keep a healthcare provider from having that important piece of personal protective equipment. I myself told people that many, many times, please save masks for healthcare workers in March. Ongoing, different message is there are masks available. We have a warehouse of masks where healthcare providers have provisions, and we are seeing in multiple countries, multiple studies, how the usage of masks are helping reduce the spread in communities. I just want to reiterate, if you need resources on where a large meta-analysis, that means looking at many, many different studies. One that I have referenced a lot that was done in June is 172 observational studies, because we can't do a randomized control trial. That's what we do for health recommendations. Observational studies over and over how masks and how social distancing have limited the spread of COVID-19. I hope I have an opportunity to speak later as a business owner and a member of the community, because there are many other vulnerabilities that exist other than health vulnerabilities. We, as a community, have the opportunity to look at our population as a whole, and as a business owner, what will help my business stay open? I hope to get a chance to talk about that more later. But as the health department, we know that if everyone in the community were to wear a mask, we would be protected and we could contain the spread of the virus. If the schools, it's a difficult choice for our schools, but I'm talking with them about if you have a classroom where there's a student that becomes positive, that whole class would be considered exposed without a mask, and they would have to stay home for 2 weeks. That's a burden on me as a parent. That's a burden on the teachers to do distance learning. If those students are wearing a mask, they could potentially stay in the building, in the classroom. So things like that, we're asking people to have to go home. They may not have health insurance. They may not have the resources they need to
Screen sharing, am I able to share my screen?
Uh-oh, I have some non-muted people. Those are other factors we're considering when we're talking about containing the spread of COVID. It's protecting our vulnerable people who are vulnerable with their health and with their finances. So as the health department, we recommend the community to have a mask policy. This is tough, but I know as a business owner, this would help my employees stay healthy. It would help us contain the virus and help our hospitals prepare for potential influx of new patients. I hope to try my best to answer any questions and look forward to hearing other comments.
Okay. Thank you, Maggie. The slides that we could not see, can you have those available? Is there a website where they can look at those, or can we have a link set up so if somebody wants to see them, they can?
Yes.
Absolutely. I can immediately share them on the Garfield County Health Department page.
Okay.
And I'll do that as quickly as I can.
Okay. Thank you, Maggie. Let's see. Next up, Finney.
Hello, I'm Finney Matthew, Chief Hospital Executive at Integris Bass here in Enid. So I'd like to thank everyone for being engaged in the discussion and being passionate about what they believe. Just want to give a quick kind of update on our hospital and what we're seeing out across the state. So from access to ventilators, we have enough ventilators to take care of patients at this point. In terms of beds to take care of COVID patients, we have enough beds at this time. We can take more patients. We have some staff on hand. What I will caution everyone, though, is that looking at any single statistic in isolation is not a good way to have this discussion, particularly as it relates to hospital capacity, because on one hand, we may have beds, but we may not have the staff, or we may have beds, but we may not have the right kind of beds. And also our bed capacity changes very quickly. It's something we manage on an hour-by-hour basis in our organization. There was much concern when a statistic went out that we didn't have ICU beds. At the moment in time that spreadsheet went out, that was accurate, but an hour later it was different. So I will say that the big concern right now we have is the nursing shortage overall, not just in Enid, but across the state. As far as the other Integris facilities in Oklahoma, we're pretty much at 100% capacity in Oklahoma City. So what we've seen here as a change is we're seeing calls to take patients from a greater geographic area than we normally see. We love to take care of patients in Northwest Oklahoma, but we're getting calls from across the state now because the beds are full, and that's both a bed and a staffing concern. So I will say that as we went through the first part of this COVID issue, it is now looking different. It feels different to me, at least, as a leader in the healthcare community than what we saw in the past. And there's a greater sense of urgency. That sense of urgency extends to when we move into the flu season. I can share with you that all flu season, we are struggling to find bed capacity within the organization. So to put additional COVID patients on top of that will be difficult. So we support 3 different social interventions. One is that social distancing, which I think we're all familiar with now. 2 is hygiene, hand hygiene particularly, and 3 is community masking. As unpopular as we know that is from a public health standpoint, that's something we support, and should the council decide to make that decision today, we would support that. We found that to be effective in flu season. It's protected our caregivers when they're taking care of patients at the bedside as well, and just as a generally accepted way to stop the spread of virus. So thank you for your time, and happy to answer any questions that you have.
Okay, good. Thank you, Finney. I appreciate it. I think right now we're just going to move on and get the presentations done so we can start hearing from the audience.
Do you want to hear from Krista?
Yeah, Krista, would you like to speak?
Sure, I'll be happy to. Well, good evening. This is Krista Roberts. I'm the CEO at St. Mary's. And with me tonight, I have Deb Bartel, who is our infection control practitioner in our organization. And I also have Dr. Sarah Oldham, who is one of our hospitalists, and she is a family medicine physician, and she is also our chief of medicine, and she is very well versed on COVID-19 and serves as a great local resource for us within the hospital. So both of them are on the Zoom call with us tonight if you have any clinical related questions. And I just want to thank Maggie and Finney both. Really, this pandemic has escalated, and it has been an all hands on deck. And your healthcare providers and all the medical staffs at both the facilities and all of our surrounding areas have really come together and worked to communicate amongst ourselves, and we've developed surge plans to hopefully accommodate any kind of demand and surge amongst our community. So I just want to thank all of our healthcare partners as well. And you know, I've lived in this community now 30 years, so I'm very vested in the well-being of the residents of the community and moving Enid forward and continuing our economic rebuilding process as well as we try to manage through this pandemic. I think one of the things I would state to you is healthcare professionals, we were not surprised by the recent increase in the COVID activity. We saw this coming. We knew it would be coming as we all became more active in the community, as activities started resuming. We knew that this would be occurring. We saw it occurring on the coast. We saw it occurring in different areas of Oklahoma before it occurred in Enid. So we had the benefit of seeing how that did occur and responses and learning from that. If I were in your shoes right now as a community member, I would want to know that my local hospitals could have the capacity and capability to care for me. So I'll speak just briefly because I'm going to keep my comments brief. I know that it's going to be short tonight, timing, but we do have capacity in our ICU unit. We've been fortunate. Right now, we're currently operating at 27% of our capabilities, so we definitely have some capacity there. We also have capacity on our med-surg units. Also, what has been in the news, so let me just speak to it. We're currently only using about 12.5% of our ventilator capacity. We do have surge plans in place that could expand each one of those areas should the demand occur. We are not at that point right now. We are definitely seeing the same trend that the rest of Oklahoma is seeing, and that we are seeing a younger population now be hospitalized. Some of these folks are quite sick when they come in, so that we are following along with the state and national trends as you are seeing and hearing about that. Both of your hospitals, I want to tell you, have the capability of obtaining remdesivir, and we have obtained remdesivir to administer. We also have the ability to administer the convalescent plasma to COVID patients if that is indicated. And that is important because those have become the gold standard, and that's what you should want from a community hospital. And so I want to reassure Enid that we are able to care for you in that situation. As a healthcare provider, we have implemented universal masking for all of our staff and everyone entering our doors. Obviously, we care for a vulnerable population, immunocompromised patients every day. We never know when we're standing next to one in our hallways, and so that is why we moved to a universal masking protocol, and so we've all been adhering to that. And let me, I know we're on a time constraint tonight. Let me pause and see if Dr. Oldham would like to add any further comments at this time.
Hi, yes, it's Dr. Oldham. Can everyone hear me?
Yep. Yes.
Okay. So I've tried to get my video to work, but it's not working. But so a big issue that I'm a hospitalist here at St. Mary's, an issue that's come up in the past just about 7 to 10 days. As Finney alluded to, the city and metro areas and Tulsa, they are all full. So here in Enid, we do have great capability to take care of patients, but there are some services and specialists that we flat out do not have here in Enid. We are not able to transfer patients out at this time. So if I have a critical patient in the ICU, that critical patient is staying in my ICU, and we are having to find ways to help take care of them because the metro areas are completely full. And as Krista said, we do have the capability to physically expand our beds, meaning we can physically put more patients into this hospital. But as Finney also alluded to, that takes staff to cover, meaning Enid is on a medical island. We don't have an infinite number of doctors here. We don't have an infinite number of nurses here to take care of patients. So if a few of our doctors become ill or a few of our nurses do become ill, that impacts our ability to take care of these patients immensely. You have to have safe staffing numbers. You have to have a safe amount of patients that one doctor can take care of. For the hospitalists here at St. Mary's, there's 2 physicians here on call every day, but you don't want that physician to see the 40 patients in one day. You want us to be safe. You want us to be able to take care of your family safely. And keeping to that, even though it might not be an influx of straight COVID patients, we still have to be able to help take care of your heart attack and your stroke safely. And if we don't have the staffing here to do that, that is when it becomes a problem. So physically, we can expand our bed capacity, but how are we going to safely staff that if people are calling in sick? Masks, as Maggie said, are a proven way to help reduce transmission. Meaning if I'm an infected person and I'm wearing a mask and I'm speaking to my patient, that level of exposure and level of transmission risk is lowered by masks. It's a great way for the community to be able to open back up. I'm a mother of 3. I want school to be open. I want my family to be able to go out and enjoy things that we haven't been able to go out and do. And I really, really do feel that masks are a positive, easy thing to do to be able to do those things effectively. To be able to go out in the community and to keep businesses open, to have school open, but most importantly is to not put any more stress or strain on the hospital system. Because like I said, theoretically, yes, we do have this physical bed capacity, but Enid has very limited resources for the medical community, both nurses, CNAs, doctors. We don't have an infinite large group of medical professionals to help take care of people. And what's coming into Enid is staying in Enid because I cannot transfer people out. There's no bed capacity in the city or the metro area. We've already come into some issues with this. And so as a community member, if you come here to Enid, I want to be able to help take care of you and make you better. But we all are going to have to kind of do our part in reducing the transmission and trying to help keep each other safe so we can just move forward and get past this. That's kind of all I wanted to touch base on. And I'm happy to answer any questions that that might come up.
Doctor, I actually have a question before we move on. Part of what I think we've been aware of throughout this particular disaster, the idea that hospitalization rate is a lagging indicator, that we can't simply look to hospitalization rate as the indicia to use to take additional precautions.
Right.
Because if we wait until there are hospitalizations, it's kind of too late to do anything to stem that. Right. But what I don't have any great sense of, and maybe you can help us, is how lagging? Are we talking about, if we see a spike in infections in the community, should we expect hospitalizations in 10 days, in 20 days? And do you have any good sense of that?
That's just anecdotally what I see when I follow. So say we opened back up June 1st here in Enid. We saw our, like Maggie said, our cases started going up after we reopened. Then they leveled off. Then 4th of July happened. Where are we now? We're at 2 weeks later of 4th of July festivities opening up. So now we're seeing a more increase in cases. What's going to happen in another 3 weeks is 3 or 4 weeks, school's going to open. So that's going to continue to go up. So if we don't put these practices into place now, we are very quickly going to go on our exponential curve. Hospitalizations will go up. Combine that with our flu season, like Finney said, at any given flu season, bed capacity is a major issue, even here at St. Mary's. And so if all these things start to work together synergistically, we're going to become overwhelmed.
Thank you.
You're welcome.
Okay, appreciate it. And I guess you guys will be standing by if we have questions later on, but I'm going to go ahead and try and get the folks that have signed up in here a chance to speak at this time. So Pastor Burleson, would you please start us off?
Thank you, Mayor, and thank you, Councilman. And I want to thank the doctors, the CEOs of our hospitals for speaking. Let me just say from the beginning, I do not disagree with anything that I have heard. The issue for most of us here tonight is the mandatory law for wearing a mask. That's the issue. I have lived in Enid for 28 years. I'm a writer, a historian, I'm a pastor. I go to the hospitals every week. I go to nursing homes every week. I go into homes. We closed our church because we were concerned for a surge in ICUs. My wife has her doctorate in nursing. She and I converse. She abides by HIPAA law. I abide by privacy laws as a pastor. But I know this community, and I've been in homes. The Blood Institute has said that I have antibodies, and I want this council just to hear my heart. I love and appreciate all of you, and I have no problem with a mask. When I go into St. Mary's, I'll wear a mask. When I go to a nursing home, I'll wear a mask. When I go to a business that requires a mask, I'll wear a mask. But when this council says to my church, you will not have worship services without mandatory masks, I'm just telling you guys, come on. Come on. Now, here's the thing. Convince me, doctors. Convince me, council. Convince me, public health. I'm a good citizen. I'm compassionate. I'll follow. But you've got to convince me. Don't force me. We are not California. California has closed down. And what's interesting is Orange County, the schools voted last night 4-1. No social distancing, no masks, and they said it's a time for us to lead. Now, here's the thing. Everything I've heard is anecdotal. I get it. I get it. I'm going to refrain from giving you anecdotal stories of the families that have COVID. I know them. I've ministered to them. I'm not going to do that. I just ask for a little humility. All of us don't know what we don't know. And my concern is this. Convince us, persuade us, trust us. Because America was built on individual liberty. It was built upon freedom. And I close. It's hard for a Baptist preacher to talk 2 minutes. I close, Mayor and council, men and women, by saying this. I'm for you. I respect you. I love this city. But I'm telling you, academics and doctors disagree on this issue. In Sweden, you've got the leading epidemiologists saying there's going to be a boomerang in the winter for those who mask up and isolate. In the history of America, we isolate and cover the mouths of those who are sick, but we let the healthy be free. And I say, vote no. God bless you.
All right.
Well, I think I picked the wrong order to speak after him. Mayor and Commissioners, thank you for the opportunity. City Manager Gilbert to speak tonight. First off, I'm going to take the mayor up on it. I agree with everything Wade said. But I'm not here to debate the science tonight. I'm not a medical professional, but I'm a businessman. And I've made some observations. The decision tonight, whether to have mandatory masks or not, is not about money, but it's about our community. I've noticed the landscape of the community has changed much over the last 5 months. The office at our local cable company is temporarily closed. The customer service there is non-existent. Several restaurants have closed, and I suspect that there's several more on the brink of closing. If you want to purchase almost any clothing, you need to travel outside of Enid. At one time, the community surrounding Enid looked to our retailers for clothing and shoes. Now, I don't think I'm going out on a limb when I say the science on this virus is not settled. It's not. We are told one thing by the CDC, then they do a 180 with that decision. One example is the ruler for which the lockdown was gauged by to begin with. They talked about ICU beds and ventilators, but if that same rule was applied today, everything should remain as is. Oftentimes, the logic behind some of these decisions is lacking. The public has been whipsawed by conflicting statements. It seems like we are on a corona coaster. Therefore, I ask that whatever decision you make tonight, it be one that the citizens of this community respect. Confidence in our leaders, in our nation, state, and cities is waning. Let Enid be a city in which we all take pride and we're civil to one another. Now, I respect each person's right to wear a mask or not to wear a mask. As individuals, we are responsible for making decisions on our own health each day. What we eat, what we drink, where we go, these are all personal decisions. Wearing a mask is a personal decision. But do not I and all of these people have the same rights? Mayor, commissioners, I love my city as I know that you do too. I love my state, I love my nation, my country. I'm proud to say that. I've been a resident of Enid for 34 years. I want nothing but the best for Enid. But I respectfully ask you to not take away our personal liberties. For those who are vulnerable or compromised, please take precautions. But for the rest of us, please let us make our own decisions. Thank you.
Okay. We're just going to go right in order the way people signed up. Next speaker is Melissa Crabtree.
Thank you. Thank you for your time and for your presence in person tonight. I really appreciate that. I'm here tonight to demonstrate how I love my neighbor by standing for liberty for all of us. And I brought a few friends in red shirts. I hope somebody's taking a picture of all of the ones waiting outside because we have a number of those also. I emailed each of you links to 2 articles yesterday. The first was a study published on May 13th in the National Institute of Health, where 455 people were exposed to an asymptomatic COVID patient, and 0 of those people tested positive. Maggie Jackson mentioned yesterday in the meeting that I zoomed in, Mayor, I believe you were on that meeting, that we have a large number of symptomatic cases. She didn't know the specific number. She said a large number. So while many articles say that's troublesome, at least this one published study on the National Institute of Health claims that it's not. My point is that there's conflicting evidence even on reputable medical sites. Enid's population in July 2019 was about 50,000. I got that from census.gov, I believe. Based on 130 positive cases in Enid, cumulative positive cases in Enid, that means we're declaring a state of emergency for an illness rate of 0.0026 and a current death rate of 0.00004%. So do we grieve for those 2 people? Certainly. But is that a state of emergency? Not unless we are the wimpiest people on the planet, which is not something I typically hear about Oklahomans. The way I love my neighbor is to fight for liberty, theirs and mine. We have never in history masked healthy people. And let me say, now is not the time to start. Now, before you call me selfish, let me say that my son and I both have asthma and we both have food allergies. These both cause breathing reactions. I have never asked the people around me to adjust what they do so that I can breathe. And this would include the movie theater making popcorn. Because the world does not revolve around my health needs. That's called liberty. There are many people who will not handle masks well, and their health preferences matter also. And these are people who may not have a specific diagnosis. We shouldn't have to require somebody who suffered trauma, who has a difficulty with a mask, to go get a diagnosis, and then she has an official health condition to prove this. Number two, if this was really about the health of our fellow man, why does the city of Enid allow citizens to eat all manner of food that is proven to be terrible for our health, and allow stores and restaurants to sell such food? And we might say, because that doesn't affect everyone, that only affects the person who eats it. However, a lot of those really unhealthy people are on disability, and I'm paying for that with my taxes. In California, it started about masks, and now they can't sing in church. Is that what's next? Why would I trust that it's not? If it's best for our neighbor, why isn't that what we would do as the next step? Private businesses, I know Maggie mentioned that, and others are concerned. Private businesses can mandate that for their own business because that is their right to do so, and then a citizen can choose to comply if they want to go to that business or not. Again, and most importantly, there's more than enough conflicting evidence that an innocent until proven guilty thought process must be employed. So if we were to say choose liberty until, well, there is no correct answer. We should always land at liberty. We hear people say, don't California my Texas. Well, let's not Oregon our Oklahoma either. Thank you all for voting for liberty.
Okay, thank you. Next up is Ruth Ann Mills. Ma'am?
Enid Mayor, City Council members, Enid residents, thank you for the opportunity to speak. My name is Ruth Ann Miles. I moved to Waukomis in June of 2006. Then I moved to Ward 2 of Enid in December of 2016. I am the wife of a pastor. For the past 19 years, I've been a homeschool mom. I am currently active in that role. I'm a simple woman, so I'm going to share simple thoughts. We have an anatomy designed to take in nutrients to nourish our bodies and to eliminate waste. Using the respiratory system, we inhale oxygen to fuel our bodies, and through a process using the alveoli sacs to exchange oxygen for carbon dioxide, which is one of the waste our bodies produce. The University of Washington neuroscience documents that 15 to 20% of the oxygenated blood is pumped to the brain. My father is a retired lieutenant colonel of the Air Force. I've lived in several parts of these United States and overseas. I have not encountered a culture, race, or community that regularly consumes and digests their own waste. The only time I have heard of this would be an extreme abuse situation. Why should we be mandated to inhale our own waste, depriving us of oxygen? I am grieved about a society that would infringe upon the rights of its citizens on how to breathe in air at any time. I urge the City Council to not mandate its citizens to wear a mask in public, vote no on mandatory mask wearing, and keep voluntary mask wearing. Thank you very much for your time.
Next up, Lori Peterson.
Hi, thank you for allowing me to speak, and I too am very grateful that you all came because I was told that I didn't think you all would be here, so to me that shows that you care enough to come listen to those that want to have a voice. So I'm going to start off really quick, and you might say, you really want to spend your 2 minutes doing that? Yes, I do. The Lord's Prayer, and if you want to speak it with me, then please feel free. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, and the power, and the glory forever and ever. Amen. And I have that memorized, but nerves might have gotten that mixed up. So I battled wanting to come up here and do this because I don't like getting in front of people like this. But I also feel like if the silent majority don't speak up, then we're not going to have a voice. So I'm not doing this because I think I'm somebody. I'm just a normal person. But so something that came to me was I keep feeling like, what's the agenda here? What is the agenda? And I noticed on your thing that you've pre-printed to sign if this passes, it says it's an agenda. And I'm not saying you mean that in a bad way, but there's two meanings of agenda. A list of items to be discussed at a formal meeting, which is what we're doing, but there's another meaning, and it's the underlying intentions or motives of a particular person. And my heart and my prayer is that you guys have prayerfully taken this to the Lord before you make a decision to mask so many people that don't want that. That is not the consensus of the people to want to have a mask. So I feel like we should be allowed to make our own choice, and this has nothing to do with what we're talking about, but I'm going to go there anyway. You allow women to make the choice to take an unborn child's life. They have that choice. I think we should have the choice of whether we want to wear a mask or not. I think we're big enough as adults to make that decision. So that is pretty much all I have to say. I have some more here, but I want to end in this, and I'm starting with Scripture, and I'm ending with Scripture. And this is, to me, instead of masking the people, how about calling the people to prayer? If my people who are called by my name will humble themselves and pray and seek my face and turn from their wicked ways, then I will hear from heaven and I will forgive their sin and will heal their land. 2 Chronicles 7:14. So I pray that that's what we do as a city. Maybe it would spread to the state. Maybe it would spread to the nation. That's what we need to do. So thank you for your time.
Just a point, when it looked like everybody was going to be participating, all of us were going to be on Zoom. We have to do that as part of the Open Meeting Act. If we're going to have a hybrid conference or a meeting that includes people in attendance and not in attendance, it's okay if you say they're going to be Zoom and then show up, but it's not okay if you say you're going to be here and then you do Zoom. So that's the reason we did that, and you'll see that in the future as well. It doesn't mean we're not coming to the meeting.
That's why it was written on the agenda that way. The agenda had it listed as a Zoom meeting because we're required by the Open Meeting Act to say that we'll potentially be there.
Yeah, there was never any intention,
for
all
us
of
not
us
to be
intended to come from the very beginning. So I just wanted to clear that up, but it's one of those nuances that gets in, and so that's how we have to deal with it. So if you see that in the future, I just didn't want you to be alarmed. Next up, Emily Laddick.
Good evening. My name is Emily Laddick. Thank you for this opportunity, and I'm glad you're all here. Since the pandemic began, has there been a moment that you feared you or a loved one has been exposed to COVID? I was faced with this reality back in March when a neighbor needed help with his wife. My always faithful Marine husband went to help however he could. The next day, our neighbor was diagnosed with COVID, one of the first in our community. And since my husband had direct contact with her, we immediately isolated him in our home. For 2 weeks, he checked and waited for symptoms to develop. And by the grace of God and the prayers of our church family, my husband never developed symptoms. I am against the proposed mask mandate because it will criminalize constitutionally protected rights. This past Sunday, I attended my son's church in Oxford, Mississippi. I noticed a police car and an officer walking around the front entrance. I thought, that's weird. I've never seen an officer before the service. Usually, they're there to help after with traffic. I wondered what had happened that the police would be at the church. So I asked a greeter on my way out. She said that he was probably monitoring mask compliance. Enid. This proposal will immediately begin the policing of our churches on Sunday morning. This is an outrageous assault on our First Amendment right to the free exercise of religion and will make criminal how most people in Enid attended church this past weekend. I do not support policing churches and can't imagine the chaos this mandate's enforcement will create in our community. Friends, I'm pleased to see so many motivated to participate in our local political process. I want to thank all of our city government officials for your voluntary service to Enid and representing we, the people of Enid, in our local government. Your mask proposal has animated many to consider the role of government in their daily lives. Mr. Ezell, Mr. Waddell, and Mr. Mason, we're closely watching your votes because your terms expire in May of next year. Mr. Mayor and other city council members, if you vote to pass this mask mandate, I believe you're meeting the people of Enid that will be some of the first to sign the petitions for your recall.
Okay. Dan Snyder?
At all.
Council, I appreciate you guys being here. You guys have had to make decisions through these last 5 months that are unparalleled, and this vote might be one of the most important. With that being said, I'm also not a medical professional. I am an informed citizen, and this is not our first epidemic, nor our first pandemic that we have gone through as a nation. And at no time in our past have we ever had to go through something like this where we've had to decide what our government's going to tell us what we need to wear and what we need to do. With that being said, this vote needs to go. It needs to come off of the government and stay on business owners and our citizens on what they decide they need to do. With that, I'll be short. A lot of what I wanted to say has already been echoed. I appreciate it.
I appreciate your courtesy. Thank you, sir.
Before we go any further to the next person who signed up, a couple quick comments. First of all, what is being proposed is simply not unconstitutional. It is constitutional. No court has ruled on it. And that's who gets to make the decision on what's constitutional and what's not. That's what we have courts for. Second, I'm not there tonight because I don't want to expose my news.
Please let him.
Excuse us.
Can you please let him speak?
Not a single person has been booed yet. We have no intention in yelling, shouting. We have no intention in shouting anyone down. And one of the first things that we prayed when we took in the name of God was that we were going to treat everybody in here with dignity and respect. Who's presiding over this? Because if you really want to invoke, really invoke the rules of order, then you know who's presiding over it, and they have the discretion to make a change if they choose to do so.
Shouldn't that be spoken? Shouldn't that be spoken that we're going to make that change?
Can I get back to that?
The mayor at any point in time could have told Ben to be quiet and don't say a word. He chose to let him speak.
Right.
He doesn't have to tell you that.
Who elects that?
You did. Okay, we're going to let talk.
May I, George?
Yeah, but be considerate of their time as well, Ben, please.
I'm happy to be considered their time, but we're going to be voting.
Yeah.
The 7 of us.
No, I understand. Yep.
And
So are we?
Let him talk, please. Let him talk.
Let me express this. If you keep speaking out, we're going to have to ask you to leave. Give Ben the right to say his opinion or his side. You'll get your chance. Let's keep this fair.
Okay.
Thank you.
Go ahead.
It's important that we all not just think about our own specific needs. We have to look at the greater community as a whole, and we have to look at the secondary and tertiary impacts of simply being incautious in the face of advice from the actual public health experts. And I implore you all, don't discount expertise. Don't discount the advice of doctors. Do not discount the advice of public health experts, because those are the people who are going to be saving our lives. Let's err on the side of caution. And before we hear the same arguments about unconstitutionality that's simply factually inaccurate, there are things that are true and there are things that are not. And the value of expertise is been written off by the first half a dozen of our public comment folks, and that's just not excusable. We need those people. We should respect those people. Thanks, George. I appreciate it.
All right. Okay. Next up, Megan Hallwaddle. I'm sorry if I mispronounced that.
Actually, you said it right.
Oh, points for me.
Thank you for the opportunity to speak, and I'm actually very thankful I got to speak right after Ben said his piece, because personally, I am here to ask you not to impose a mask mandate. But my stance is not because of solely liberty. It is because back when this stuff started in March, I was as concerned as everybody else. We didn't know what we were looking at. And the CDC and the World Health Organization has dealt with a lot of unknowns. They thought they knew stuff and they released information at that time, and then things changed and they released it, and it's been this constantly revolving door of this is our practice now, this is our practice now, this is our practice, and it's led to a lot of flip-flop, which led me, as a mom of an asthmatic allergic child, to try to figure out what I needed to do for my family in their best interest. I also am a truck driver, and my son goes with me on the road. We're in a lot of different places. Some of them, like Dallas and Houston, are very big hot spots for COVID. And it was important to me as his parent to look into data that was consistent, to figure out if a mask would be effective for him, for myself, for the people we come in contact with, and if so, which mask? Because we have people, even up here today, with various types of masks. We've got people wearing medical masks, people with the cloth ones, some that have found some of the N95s. Not all of them can be consistently effective. And in my search over the last few months, I have purposely sought out sources that have had waited to release data until they had time to independently research and come out with stuff. And I've come to 4 different places that are medically respected as experts on what their consensus is on the effectiveness of these masks. The New England Journal of Medicine, OSHA's website, who is over all industries and their safety stuff, Mayo Clinic, who cites the FDA in their studies, and the Center for Infectious Disease and Policy, CIDRAP, indicate that widespread mask policies are ineffective. And they go through to explain the different types of masks and why. Cloth masks they find to be ineffective because they're so porous. They don't fit tightly over your face to block things out. They can't even block out dust from drywall. And that's something you can see. We can't see these infectious particles. So if they can't block out what you can see, they definitely are not blocking out infectious particles from being breathed in or out. And because of the lack of filtration and the poor fit, that's why they recommend that those are not used as masks to prevent the spread of COVID. The surgical masks, again, do not seal entirely. Yes, you can get them with the little metal pieces, but I went to the eye doctor and complied with their request to wear a medical mask. And even squeezing it down over my nose, I still had to put another layer in of Kleenex between my skin and the mask to keep it from fogging up my glasses and their machinery that they were using to do my test. And it doesn't have the ability outside of a limited medical building to filter out that much infectious particle. And over a prolonged use, as the mask gets wet on the inside, it becomes less and less effective. And if you don't wear it above your nose and below your mouth simultaneously, it has no effect. You might as well not wear it. The N95 mask, now I'm not positive because I was unable to find any accurate stuff beyond what these studies showed, and I did not want to come with stuff that was not verified. But outside of these studies, the N95 mask at the time these were posted within the last 5 weeks is defined as a respirator. Respirators, including the N95 mask, must be fit tested. Otherwise, they are not effective, and they are not recommended by any of these groups of professionals for use in the effectiveness against the spread of COVID, for the simple fact that untrained people will not wear them properly. And if they are not fit tested, they do not seal completely, which leaves gaps for those infectious microbes, along with other things, to get inside and be breathed in and out. These masks that have the one-way valves, they do make it easier to breathe. They do filter the air for you breathing in. But as the wearer breathes out, they breathe out, or they release all of that air, and it's unfiltered, so it doesn't protect anybody outside of you. My stance on requesting to not have a mask mandate is not because of solely my individual liberties. It's because we don't have consistent data on what masks are effective, and I don't want to be put under a mandate and face fines or possible jail time, as some communities have, because I refuse to wear something that's not going to fully protect myself and my family and the people around me. Thank you.
Next up, Amy Martinez.
Hello. Hi, my name is Amy Martinez. I'm 12 years old, and I come in peace today to talk about the mask mandate, and I am here to persuade you. If you know me, you would know that I have type 1 diabetes, which is an autoimmune disease, and nobody knows why I got it. And look at me, I'm as healthy as I can be. I am not afraid to tell you nor show you that I have type 1 diabetes. For the past 3 years since my diagnosis, it has always been a roller coaster. But ever since 2020 started and the whole COVID pandemic started, it became even more of a roller coaster. So due to that, my mom and I stayed in our house from March to May. But I need to get up and go out. I'm a very social person, and I like going shopping, I like going to school, and I like seeing my friends. So the only way right now to help people like me that with type 1 diabetes, cancer, and every other disease that compromises their immune system, to have a somehow normal life is to reinforce social distancing and wear a mask, because a mask will help you and your neighbor. I have heard many people say that a mandate like this will compromise their liberties, and I respect their point of view, but let me tell you mine. I have my liberties also, and one of them is feeling safe no matter what and having the right to live. But right now, I feel as if that is being compromised with the current situation. When I go to the grocery store with my mom, and 10% of people are wearing masks, including my mom, my dad, and I, that's not really fair to the people who are wearing masks. I protect you from my germs, please protect me from yours. And if you still don't believe me that masks save lives, as I have seen in comments and Facebook posts, listen to this case report published July 14th in the CDC publication of Morbidity and Mortality weekly report. Focuses on 2 hairstylists at a Missouri salon who unknowingly had COVID-19 in May. According to the detailed report, the first stylist worked with clients for 8 days while symptomatic, and the second for 5 days over the course of around a week. 130 clients visited their salon and got cuts or treatments from them both. Both of them, the stylist and the client, were wearing masks as well. Not a single client or any of the other stylists in this in this became infected as a result. So if you don't think that wearing a mask can save your life, please think again. Please, please, please wear a mask for you and for me and for everyone else around you to be safe, so that one day we can go back to our normal lives without wearing them, going to our Pokes and Sooner football games, to church, and everywhere else we want to go. But if we don't wear a mask now, then who knows how long we will be in this situation. Thank you for your time, and God bless.
Hey, thank you.
Hey, Mayor, there's a suggestion from the audience that when you read off the next person up, if you could let them know who's
on deck.
Who's on deck.
Okay.
Maybe they could be ready to come on up, because we're going to hear from a lot of people tonight.
Okay, good idea. Thank you. Up next is Neanne Clinton, and on deck is Scott Whitley.
Good evening, and thank you for hearing from us this evening. I had lots of information that I was going to share, but I actually read a report in the USA Today of a small town mayor in Arizona and the information that he shared, and I thought that it resounded with myself, so I'm going to read that off to you. So these are not my own words. These are the mayor of Eagar, Arizona, if I say that right. Over the past several weeks, I have been asked repeatedly what the town of Eagar plans to do about COVID-19, masks, visitors, riots, etc. It is somewhat alarming how many expect and almost invite a more drastic infringement on their freedoms. My response from the onset of the COVID-19 pandemic has been that we will err on the side of freedom. I have received numerous phone calls from reporters, citizens, visitors, and complete strangers to our area asking why the town of Eagar has not canceled upcoming events. Again, my response is that Eagar will err on the side of freedom. What authority does the town of Eagar or any other state or local government have to infringe on the rights of healthy, law-abiding citizens? It bears to mention that I am not one that believes that the coronavirus is fake. COVID-19 is a real virus that unfortunately has drastic negative effects on the health of some of the individuals that contract it. Just as with the flu virus, some of those individuals will die. I do not make light of the fact that its effect on individuals and families throughout the globe have been and will continue to be life-changing and or life-ending. There are many individuals that risk serious peril if they were to contract the virus. Those individuals should take extreme precautions. I certainly would were I in their position. In fact, I would invite those individuals to please stay home and not attend our festivities. But don't ask that the government require it of healthy, law-abiding citizens. If an individual is fearful of contracting the virus, I would invite that individual to take every precaution they deem fit, including wearing masks, gloves, or a variety of other personal protective equipment. Those precautions do not harm me, and I will not judge you adversely for doing what is best for you. As grim as COVID-19 is portrayed under the most drastic scenario, I dare say that we are facing a much more serious pandemic here in America. We are currently in the midst of the nation's first political pandemic. Never before in the history of America has ignorance and bigotry been more celebrated. Never before has our government been more eager and willing to take away freedoms from the citizenry. Never before has the citizenry been more willing to give them up. Benjamin Franklin warned that those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. I believe his warning is as applicable today as it ever was. Some will say that these safety measures have not impacted individual liberty. To them, I would quip Thomas Jefferson. If a nation expects to be ignorant and free in a state of civilization, it expects what never was and never will be. The right to move about freely in public is one of the cornerstones of American democracy. In a panicked frenzy created by the media, state and local governments trampled that right wholesale. History will not judge us kindly for our actions over the past several months. Okay. In closing, where would America be if our ancestors that pioneered the countryside facing a mortality rate that would make the coronavirus look like a scratch had simply given up, turned back, or laid down and died out of fear? Where would America be if our brave servicemen and women who throughout history have on occasion faced odds of almost certain death simply refuse to fight out of fear? When did we stop being the land of the free and the home of the brave? Take charge of your own life. Nobody owes you anything. The government has never been more ill-equipped to solve your problems, nor is its function to do so. This is America. Stand up and be somebody. Be brave and live free. Bryce Hamblin, Mayor of Town of Eagar, Arizona.
Okay, Scott Whitley is up and Brian Hacker's on deck.
Mayor, City Council members, thank you for the work that you do here in Enid. It is a job that I'm sure at times goes unthanked and even beyond that, I'm sure. But I have to start off and say, first of all, that I'm discouraged by how this meeting started, because you had 3 or 4 professionals that all made the case for wearing masks. And even though there are other professionals who disagree completely, you had none of them up there to give a balance. And it certainly discourages me, because I wonder if that is not a sign that you already have this thing decided and that you are pushing it and not really here to listen and decide. I hope I'm wrong on that, but that's sure what it feels like. My name is Scott Whitley, and I've lived in Enid since before I was born, so I've been here a long time. But for the last 28 years, I've served the people of Enid by delivering their mail. I'm a mailman, and a typical mailman has probably 8 to 15 miles a day that they walk out in the heat. Last Saturday, just a few days ago, the heat index was 120 degrees here in Enid. And what you're proposing, to put a mask on not only letter carriers, but everyone who works outside, is tremendously wrong. You're going to cause lots of problems, health problems for individuals. Now, I know that many who will be deciding this have jobs under air conditioning. That's great. That's wonderful. Come walk with me for 15 miles or whatever it is. Of course, now I have a driving route, but the temperature within my truck easily reaches 115 on a normal summer day. So it is hard. It would be extremely hard to wear this mask. So I hope, just another point to make there. We have about 50 carriers here in Enid, and we service every address and every business in Enid at least 3 to 4 times a week. 50 of us. You know how many of us have contracted the coronavirus? Zero. It is not this big bad virus that it is being made out to be. I understand it's important. I don't deny it. But you can't just force this on people like this, because here's one thing. Do masks work? Absolutely they work. You know what else works? Total isolation. Just stay home and don't ever go anywhere. You want to eliminate car accidents? Don't let anyone drive. Yeah. You see, you can get to that point of complete safety, but at what cost? The citizens of Enid are not ready to pay that cost. And if you pass this, you're going to set up a great conflict between the citizens of Enid and you and the citizens of Enid and the police department, who's going to have to come out and try to enforce this. Yeah. We're not ready to give up our rights. And just one last thing. Today, there was, on the radio, it was announced that in Florida there were 300 testing sites that all tested 100% for the coronavirus. Someone decided that can't be right, so they went back and checked, and oh yeah, we made a mistake. Actually, it was about 8 or 9% of those tested, not 300. Don't go by all these numbers that are being pushed upon us. There is so much falsehood that is out there. Err on the side of caution, err on the side of freedom. This would very much violate our freedom and our rights. Thank you.
Okay, Brian Hacker is up. Monica Trueluck is on deck.
Hello, thank you for your time. My name is Brian Hacker. I've emailed every one of you guys, and no, all the gentlemen here, I emailed every one of you. I'm going to start off with improvising, because a lot of what I was going to talk about was covered first. Today, Governor Stitt tested positive. You guys heard that. And they asked him, do you want to go to mandating masks? His reply was no. I could have got up pumping gas, touching something at Walmart. I could have gotten it bumping into a wall. So what's next? You're going to mandatory give us gloves? We have to wear gloves everywhere we go? After that, we're going to have to bounce in a bubble everywhere we go? No. Don't mandate it. If you're compromised, I feel for you. My brother is in Atlanta. He is immunocompromised, similar to the young lady that spoke earlier. He doesn't go anywhere. He bought a boat to go fishing. He wears a mask everywhere he goes. I sent him cases of gloves because I can get them to my restaurant. If you're compromised, I get it. But don't force it on those of us that are A, healthy, and 2, not worried, not concerned, okay? You're trying to overreach hugely, that's not a word, by having 41 active cases in our county. You know, it's not worth it. As a business person, I speak to the public all the time. I see a number of mask wearers similar to what some of you have done. David, I want to give you credit. You're the only one that walked in here without a mask and has to put one on. Thank you. Okay? Everybody else either walked in, put one on, took it off, walked in, went back in the back, and then came out with one. Jerry, you walked in with one. Congratulations. You pulled it down over your mouth 11 times while I've been sitting back here and touched your face. That's what no. You've done this. I've watched. We go back and watch it on video. I'm not trying to be, but people are going to do that because they're not used to it. You're mandating something that is not what people want to do, not people are accustomed to. Healthcare professionals, people who are ill, I get it. You have to wear them all day. That's part of the public. I own a restaurant. David, Jonathan, you were there the other night.
Yep.
Okay, you didn't tell me. I invited every one of you in the email to come to my restaurant and stand in my kitchen for 2 hours wearing your mask. You're the only one that replied. You didn't come, but you told me you work in the restaurant industry.
Can I respond to that?
You were there at my restaurant, yes, sir.
Yeah. Can I respond?
Yes.
The reason why,
don't take my time.
The reason why
I got you on pause.
The reason why I wouldn't take you up on that is one of the first bits of research that I found is that there's no evidence that it can be transferred in food transmission, so it would serve no purpose. There's no reason why I would put a mandate on your food preparers to do it.
But they're mandating restaurants all over the nation. Restaurants are being mandated. What was the temperature I showed you on my thermometer when you were in my kitchen? What does that say? 111 degrees.
I told you.
You're not going to make my people wear to do that. Come on. Am I girls who do service? No. I'm not saying. But I invited you in, and you could have said, I didn't know if you were you. I know you as a customer, but I didn't know you were you.
I told you I keep your food. It's fantastic.
Okay, keep my time. Okay, but no, you were in there. You've taken yours on and off. She's taken hers. She took hers off when she walked down the hallway earlier. You're the only one that hasn't worn one. I haven't seen you wear one. No, you wore one when you first came in too. Never mind. Okay, you're a customer. You come into my restaurant. You come in, you're wearing a mask. How do I ID you? I ID you. What do you got to do when I ID you? Take off your mask so I can see your face. You just ruined the point of a mask. Okay? No. I'm claustrophobic. I can't wear a watch. Okay, I don't wear hats. I take off my wedding ring 15 to 20 times a day because it just bugs me. Okay, I can't do it. I'm sorry. You're not going to mentally stress me out. I haven't gone to Oklahoma Heart Hospital since all this started. For all my tests, they keep calling me to come, but I can't wear a mask. Okay? I can't be confined. I tried it at my son's appointment the other day. I hung it over my ear. I got in trouble and got thrown out. Okay? I can't do it. It bothers me. You can't mandate people to do something that's going to do it. By mandating an ordinance, which is going to put, and you've already seen it, this ordinance will put citizen versus citizen. You're going to have people telling on each other, calling the police. You're going to be in my restaurant. I ain't going to wear a mask. You're going to write me a ticket. You guys eat there 3 times a week. No. Okay? No. Okay? You're creating unnecessary conflict. You're going to put law enforcement in a position of taking people for not wearing the stupid mask, a mandate that's ridiculous divide happening already. Our country's already divided. Don't make it worse. I'm almost done, Jerry. Okay, George, do not mandate masks. As a business owner, father in town, I cannot believe you'd even give up my rights. I can't believe I had to give up my rights to come here. I should be playing golf right now. It's my golf night. Okay, a right for you to take away. Vote no to any type of mask mandating. We are in America. We're not California, and we're not New York. We're in. Thank you.
Okay, Monica's up, and Gloria Kuhn is on deck.
I'm Monica Trueluck. I am a healthcare worker, and I will tell you, I am very much against mandated masking. Actually probably putting my job at risk by talking, which is a very sad thing in this country right now. Assistant City Clerk, as you spoke the names, you pulled your mask down. This is my #1 complaint. I have to wear a mask. We have these wonderful, they're supposedly surgicals, they're now procedural masks. These have never broken me out when I worked in the OR. Now I am having severe reactions to these masks every day. I have to wear a cloth mask underneath this mask, And then if I have a COVID patient, I wear my N95. The N95 is the only mask that will protect you from COVID. That has been proven. They keep saying this over and over. This little doohilly is not doing anybody any good. I have 2 immunocompromised children. One takes amoxicillin every day. She just graduated as a senior from Enid High School. I am very proud of her. She does everything she can to keep herself
Listen,
healthy.
I have to hear this.
But we do not take extra precautions. She goes to school. I have had teachers tell me that I'm crazy. I've had to bring proven documentation to make sure the days that she is sick, that she is actually sick, which is sad. This is why we might not be going to school, is because there are teachers and there are counselors out there, and I have been a teacher in Georgia for 20 years. So this should not be happening. You're having to make children come to us to get tested, which then infects everyone. So going back to the mask things, 2 immunocompromised children at work, so I wear my N95. You want to hear how this goes? I have this. I have this to protect my N95. Now I wear this. Can you hear me? No, you cannot hear me. My patients cannot hear me. My patients can't see my mouth. They have no idea what I'm saying.
I do.
She's talking in a mic.
Just being honest.
So, I'm glad. Some people have great hearing, but most elderly and most veterans do not. They have tinnitus. They have been shooting guns for a very long time. They can't hear me. Also, every time, I am always telling my patients, please pull your mask up over your nose. Your mask does not do this. This is not doing anything for you. So, in the mandate of making everyone wear a mask, it's not going to do a dang bit of good, in my opinion. I am just an x-ray tech. I'm one of the people that sees the people in the ER before they're ever tested positive. So then we go, oh, you were exposed. Yes, we are considered exposed even if I have all of this on. Okay? So I think one of the other people said that you're not exposed if you have all of this on. Yes, we are still technically considered exposed. Also,
How often are you tested?
how often? I have not been tested. Yeah. So here's the other thing. You're masking all the thieves. You're masking all the murderers. You're masking all the criminals. You're also masking all the concealed carry. Officers I work with and I see in the ER, they're already put to the test every single day. They are under stress. They are overworked, underpaid, and some of them are probably getting sick. I have no idea. I don't know those numbers. But you're going to make it 10 times worse, actually 100 times worse. Also, limiting numbers, you're going to tell us we can't go back to church. You're telling the kids they can't go back to school. You're telling sports no more, when we know being out in the sun and exercising, eating right, and doing healthy activities is the best way to stay healthy and not spread this virus. When flu season is here, there are 95 patients in an urgent care a day, if not more. Most of them, 10 to 20, are usually positive. I'm working in an ER now. I have seen 10 people that are positive the entire time of my shifts. So I don't know. I'm not saying that this is not a bad virus. I am not saying that we do not have people who are very sick in the ICUs. We do, because a lot of people have been too scared to go to the doctor when they needed to go because the media has scared them to death. The other thing is...
Okay, you're gonna have to move along here.
Okay.
You're about 4 minutes over under
Okay.
2 minutes.
Well, anyway, please, I recommend that we do not mandatory mask. I think if you wish to mask for all means. Wear your PPE. I have children that when they go out, they are wearing things that they need to wear. They are being safe. But other than that, it is against our civil liberties to be mandatory.
Okay, thank you.
And
Yeah, let's try and keep to the time, otherwise we'll be here at midnight, okay? So please try and keep with the 2 minutes. Gloria, you're up, and Jason Unruh, you're on deck.
Gloria?
Maybe she's outside.
Do you want to go check?
I'll go check. What's her full name?
Gloria Kuhn?
Okay.
You want to move on to the next one, Mayor?
Yeah, Jason, are you here? No?
Jason Unruh?
Jason Unruh? Okay. Katie Brown?
Katie Brown?
Katie Brown?
Some people may have thought that was just a sign in, not necessarily a sign in for speaking.
Oh, okay. If that's the case, that's fine, but we'll. She's not there? Okay. Let's see, Katie Brown. Mark Goring?
Mark Noring?
Goring? Is that you? All right. And Leslie?
Or we also have a lot of people who signed up online. There was a form circulating for the last couple days online. I don't know if we're going to fit them in, but at this rate, we're going to be here till midnight. I don't think it's a service to anyone, but I do think if folks signed up to speak online, maybe they were folks who were less likely to want to be in a room with people who aren't wearing masks, and I think we should at least try to integrate some of those people so we're not kicking everybody who took the time to sign up online until 10 o'clock tonight or something.
All right. Thanks, Ben.
I don't have any place to go. I'll be here till.
We'll be here all night, don't worry. You can't be heard.
Good, sir.
Yeah, I don't have much to add, being this far down on the list, because you've had very excellent speakers.
Right.
But I do have one perspective, because I'm a retired health professional. And I would like to see the data that Maggie initially talked about that supports masks, because their science is extremely unsettled, very unsettled. And you guys up there have to make some tough decisions. I think they should be recommendations. They should not be mandates. And I think those recommendations should be fluid. They should be based on the best known science. You have speed limits because we have known science of physics. Force is equal to mass times acceleration squared. But you don't have that kind of defined science with the virus that we're working with. There's so many unknowns. And the data around whether you should wear a mask or not wear a mask can make your head spin.
Yes.
There is a study that shows that Mr. Waddell, you touched your mask.
I did.
There are more virus particles on the outside of the mask than on the inside of the mask. Nobody can explain it. And you get into, and it's so complicated that it makes your head spin. But then you want to know, okay, are particles aerosolized or is it droplet particle exposure? I've got news for everybody in this room. If it's aerosolized, we're all screwed because we're all going to get it. Measles is aerosolized. Somebody with measles can cough inside of an elevator, and you can go in there 30 minutes later and get it. The reason is those particles are like smoke or like cologne. If you can smell smoke or cologne through an N95 mask and the virus is aerosolized, you can catch the virus. So my point is that it's very unsettled science. Make recommendations that people can follow. I think the community looks for recommendations, but don't make it mandates. When you start saying you're going to find people, that's a mistake. Recommendations are great. Mandates are tyranny if you don't have the data to back it up.
Okay.
Hi, everybody. My name's Leslie Schoenberg, and I want to thank you for letting me speak. First of all, you all do an awesome job running this city, because not everybody's going to agree with you or what you do, but you do it for the best of this city. And I don't think, like everybody else, that masks should be mandatory. I think it should be left up to the individual person. But what I do think from hearing everybody is we need to practice the social distancing, which is if you go into Walmart or if you go into Lowe's or go into Atwoods, there's hardly any social distancing. And if you look around this room of the people that are wearing masks and the people that are not wearing masks, it's going to be just like you're going to find outside in the city. So I thank all of you for doing your job.
Okay, thank you, sir. Wilbur Flynn, I haven't seen him. Is he here? Ah, there you are. And on deck is Sherry Ekberg? Okay, I'm sorry.
Yes.
First of all, I want to thank you all for allowing us to speak. And I'm just going to be real brief because I agree with everything that Pastor Wade said. But the only thing that concerns me as a pastor is with my wife, she kind of looks around and looks at some of the studies and some of the other cities and states. And I know we here in Enid, we consider ourselves, as one community and one people. And a lot of those states and communities that have mandated the mask, people are not understanding each side. So, we in one place they had a man and his son that didn't wear a mask, and they were going into a business, and a bunch of people who did have masks on, they began to cuss the man out and his son. And then another place, a person didn't wear a mask, and some other people were upset, and a young lady went and told a friend of hers, and he came back and shot this guy that didn't have a mask on. So I'm just saying, I wish you all would consider looking at that. We don't want to divide the community of Enid, because you're going to have people who are not going to want to wear the mask and not wear it. And then if you have people that if this is passed, they're sitting there going, hey, you need to wear the mask or else, and then you're going to have all this controversy in this. So that's going to be something that you all have to look at too, to see all the chaos is going to cause between neighbor and neighbor, and family and family. So, amen. God bless.
Hi, I'm Sherry Yulberg, and I am actually from Pond Creek, Oklahoma. So I do not live in Garfield County. However, I probably spend 90% of my disposable income in Enid because you all have the services I need. However, since COVID showed up and things have changed, I'm going to tell you a little bit about what I cannot do anymore. I cannot get my hair cut, so excuse me. I cannot wear a mask because I am claustrophobic. I have lived with this, and I make adjustments. I have not been to the doctor about it. However, if this becomes a mandate, in order for me to be able to come to town and buy gasoline, buy clothes, buy whatever, I'm going to have to somehow go seek medical help to be declared disabled so I can meet your exemption. But I cannot wear a mask into a doctor's office. I have not been able to go to a doctor or a hospital since all of this started. And I understand that we do need to protect our vulnerable population. And I'm sure most of y'all are thinking I'm part of that population, and I've been this way since I was like 30. So I am there, but I also have hydrocephalitis. I also have high blood pressure, that sort of thing. But if you all mandate this, I don't know how I am going to be able to survive. I am not going to give my money to Amazon. Sorry. I would much rather spend it here with a local business that can use it. You can find all sorts of scientific studies that go both ways. Oh, that's my time. I'm sorry. Look at Japan. Japan has been wearing masks since 2003. They had a spike with COVID in March, April, just like we did. And then it went down. But golly gee whiz, guess what? They're having a spike right now, just like we are. We do not know enough about this virus. We know measles and polio don't change, and we can get a vaccine and take care of it. We don't have enough information. Y'all, no one can tell me when this virus is going to go away. So I am definitely not for your masks, and I realize you all have a very hard job, and all I got to say is God puts in control who he wants in control, and that includes you all. That was talking about letting everyone be heard, whether we agree or not. That is what is great about this country.
Okay, thank you.
So thank you for listening to me.
Okay, next up is Darcy Van Buskirk. Okay, and I'm sorry, Daisy. On deck is Troy Wood. And do we have access to the online list that Commissioner Zell was talking about? We need to start mixing some of those in here, I think. Go ahead, sir.
That you guys let us speak tonight.
Yep.
I come from both sides on wearing a mask and not. I've been in the medical field or whatever. I had to take a step back because I honestly believe in Psalms 91 that I'm protected. And where I worked at, they told me I had to take a COVID test along with other things. I stepped back because I will not take one. I've seen both sides. My little sister's in law enforcement, and like everybody else has said, and then my older sister works at one of the hospitals. They already got enough stress or whatever. But I'm going to protect HIPAA violation. But when I was doing, not just myself, we've had residents in nursing homes. Not only does some of the families not come, they're already depressed. So, where does it end? I understand protecting them, and I wore a mask because I had to. But what I'm saying is most oxygen levels, you have to be at least 90. When you have those masks on, I'm not just talking about employees. There's some employees, some residents that we have, some's healthy, some's not. But some of the residents, we had to make a mask, and when you stuck the oxygen on it, their oxygen, like I said, is supposed to be at least 90. They were like in the 60s and 70s. So, I'm definitely not for this, so I've taken both sides. I've taken criticism, and I did. And I know you guys have got a hard job, but as far as that's why I like living in the United States. We have so much shit, and no matter, you can already tell I'm Christian, but if you're Muslim, gay, whatever, slow to speak. I'm slow to speak and quick to listen. I don't try to discriminate. I know you guys got a hard job, but my theory is, where do we draw the fine line of what they're calling essential and what is not? Because you got Walmart. The only thing this virus has told me, besides the research that I've listened to, is Walmart and all the big stores are in control. Where does it come? Bars are closed, mom and pop stores are going. Where does it come on what can be sued? We have freedom to choose whatever we want, so that's my stand against that. That's told me one thing, the media's just dumped this. And like I said, my little sister, she's in law enforcement. She trains officers all over the state of Oklahoma. So we've kind of talked about it. We feel different. She thinks masks, but like I said, if you mandate it or whatever, like everybody else said here in Enid and everywhere else, the police officers, they already got enough to do. She makes good with the state. She makes less than $50,000 or $60,000. She doesn't do it because she wants. She doesn't do it for the money. She does it because she loves it. And also, I feel like you gotta you got to choose what you want to do, and if you're miserable there, you need to find a different career. Thank you.
Okay, Troy Wood is next. Did Susie Hinkle get a chance to speak yet? I missed you, I'm sorry. You're up next, okay?
I guess this is for Ward 3 Commissioner, because he said that he hadn't heard from any actual medical professionals. And so I'm going to be reading from the New England Journal of Medicine, May 21st, 2020. The article is Universal Masking in Hospitals in the COVID-19 Era. I'm only going to be reading the second paragraph, and then I'll be finished. It says that we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and in parentheses it says, in some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. And this final sentence really resonates, and I want to tell you who these people are that wrote this. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. That was written by Michael Klompus, MD, and Master of Public Health. Charles A. Morris, medical doctor and Master of Public Health. Julia Sinclair, MBA. Madeline Pearson, doctor, nurse practitioner, and RN. And Erica S. Shenoy, medical doctor and PhD. That's all I have to say.
Good. Thank you.
Thank you very much for taking time to listen to me. Most everything that I would like to say has been said by several people, so I'm going to be very brief.
Okay.
I'm wondering, I didn't hear the medical professionals say that social distancing was effective, because I thought that was something that wasn't. And I'm going to let you know, when I'm at Aldi's and somebody has a mask on, I make sure that I am 6 feet away from them. And I promise Ben Azell, if I see him there, I will wait outside till he's gone, and then I will go in and shop, if that'll make him feel better. But I don't know if that works, then why do I need to wear a mask? I don't understand that. So that is one of that's my biggest question right there for I would rather see you mandate social distancing than for me to wear a mask. And I am a hairdresser, and I would gladly, I cannot imagine standing and wearing that all day. It seems very uncomfortable. We had to do that for a while, and so I don't want it to go back again. But anyway, that was one of my biggest things. It hasn't been said why I didn't hear from the medical professionals whether the social distancing works. And if it does, why can't you just mandate, stay 6 feet away from anybody wearing a mask? And I would certainly do that for them.
I can, if anyone wants to comment, I'm Dr. Oldham. Am I on?
Mr. Mayor, Garrett is attempting to say something, if you'll allow.
Sorry, yeah, it has my partner's name on it. It's Dr. Oldham. Social distancing does work. Masks are for when social distancing isn't possible. So like in the grocery store aisle, when you're standing next to someone in the grocery store, that 6 feet isn't quite possible. When you're standing in the checkout line and things like that, for a hairdresser, 6 feet apart is also very difficult to do, but social distancing definitely does work. It is proven to work, just like the masks have been shown to prove. And Maggie has linked some articles here in the chat on the efficacy of mask wearing. Thanks.
Okay, thank you. All right. Karen Carter? Is Karen here? Okay.
What are you doing
Well, I'm looking at some of the online folks, and many of them have already spoken, like Brian Hacker, Maggie Jackson, I guess, spoke, but as a health professional, not as a business owner.
So we didn't want to speak as a business owner.
Huh?
He didn't want to speak.
Yeah. Let's see. Andrew Long, are you on? Are you signed on? Okay. No? How about, okay, Brian, we already talked about. Marciana Marcina Riel. No?
Not everybody is using their name, and so some just say iPhone. So I don't see that name. I don't see that name here.
But if they're signed on, they can hit the mic and speak, right?
Should be able to do that.
Okay, so I'm going to go ahead and read names, and if I read your name, please unmute your microphone and go ahead and speak. Marcina Riel. Okay. Scott Jessen. Okay, please come forward.
I had a whole bunch of stuff prepared. A lot of people covered everything so far, so I'd like to give you a copy of everything here and a copy of the Constitution for you. I have a whole box. Anybody wants one, let me know. Go back. Okay, now, had to do a lot of adjusting since I came in late with all the other speakers. So, I'd like to first start off with saying thank you all for doing this. I don't envy you. I know it's a tough job, but I appreciate your consideration. I am concerned about my safety and the safety of my family, especially with this COVID threat. While that is true, I am also concerned about the liberty of every single Enid citizen. Let's talk about trust. At first, we didn't have much of a choice. Either we did what they say or risk mass death immediately. It was a crisis. Nearly no facts or data were presented, and all we had were projections and guesses by experts. Considering the alternative, we had no choice but to do what they said. So they said, wear masks. Then they said, don't wear masks because they don't work, and we have to save them for the medical people. I still don't get that one. Then again, they said, wear masks, now that we can't find them anywhere. Then the U.S. Surgeon General made a video to demonstrate how to make them. A few days later, he said, well, we have no data that show that they actually work. Later, the WHO actually tells us that masks can do more harm than good. Then masks became mandatory in many places. Then we were told that prisoners were being released so they don't get COVID. Then we're told that we will be arrested and put in jail if we defy certain cities' no church orders. That's right, the same jail that they were taking the prisoners out of. Then we're told we do not have to wear a mask if we participate in city-sanctioned protests. Now, elected officials are attempting to mandate them again? Please explain to me why we should trust these experts. There are two ways to get someone to do something: force and reason. I don't have force with you guys. You guys have the power of force that we entrusted you with. Please use it judiciously. Not today. Experts have failed time and time again to present complete, accurate, and consistent data to properly explain the why. So, if you are trying to limit deaths, please consider this. As of yesterday, Garfield County had 2 recorded deaths, percentage rate of 0.003%. In 2018, latest data I can get, Garfield County had 659 total deaths, a full 1% for all purposes. As of yesterday, Oklahoma cases, active cases, were 0.1% and sharply decreasing, while the recovery rate was also sharply increasing. All this data is at the end of the packet I gave you with the references, and they are all from OK.gov. Garfield County active cases were 0.07%. Garfield active total deaths, 0.003%. Enid active cases, 0.08%. Enid total deaths, 0.004%. All of these were from yesterday. Okay, so if taking these numbers into account, where is your panic and sense of urgency over the annual flu crisis? Where is your panic and sense of urgency over the drug crisis, the suicide crisis, the vehicle wreck crisis, the homicide crisis? All these crises have much higher death rate than COVID-19. Why isn't your hair on fire over these crises? Like I said, all of those statistics are in the packet, and they are from yesterday, from OK.gov. And some of those actually conflict with the data that we were given today in the beginning of the meeting. That, along with my opening, Commissioner Enzel, is why I do not trust the experts, not the least of which the ones you have handpicked for us today to hear. If this order fails to meet your standards, what will you do next? And next after that? And next after that? What is your limit? Where will you stop? Where will your replacements stop? If you do this, how will this new power precedent be used and abused by the people that replace you when you and your families will have to live under their usurpations? I believe there was some conversation at the last meeting similar to that concern on a different matter. I believe it applies to this case as well, sir. What is the exact infection rate at which you will rescind this order? What is the rate at which you will order businesses to shut down again? What is the rate at which you will order everyone to stay at home and not go out at all? How far are you willing to go? If you don't define these things, you are just rolling with it and shooting from the hip. Would you want to take orders from somebody like that? Would that instill confidence in you from that person or group? Would you trust that person or group? Not me.
All right, sir, you've exceeded your time by quite a bit. But
I'm sorry, sir?
About you ready to wrap up?
Okay, yes, sir, sorry.
You're about 4 minutes over on your 2 minutes.
I apologize. Okay, here we go. So, you rightfully recite the Pledge of Allegiance prior to the meeting. Please consider the line that states, "And to the republic for which it stands." We are a republic, not a democracy. A republic protects the rights of every individual equally, regardless of how many others want to infringe upon them. How many oaths of office state to keep us safe? Do yours? Do you suppose the signers of our Declaration of Independence were worried about their health and the health of their families? Of course they were. Who isn't? How different would this nation of ours be if they were more concerned about their safety than our liberty? I request that each one of you explain your vote, and please keep in mind that sometimes doing nothing is better than doing something, just for the sake of being able to tell your boss, I did something. 15 seconds, promise. I'll finish by leaving you with two final things. Did Patrick Henry say, "Give me safety or give me death"? No, sir. No, ma'am. He did not. He actually said, "Give me liberty or give me death." Please help me stay proud of Enid. Defend liberty by not ordering mask usage so that each citizen can decide what is best for themselves and their family. Thanks for the extra time, sir.
Hi, Mayor. I heard my name as a business owner, potential opportunity to comment as a citizen, and I wondered if I could have that opportunity. I don't want to take a lot of time, just...
Go ahead, you got 2 minutes.
Okay, thank you. I didn't want to take extra time, but since I was asked to share data in the beginning, I wanted to give a different perspective. There's so much to comment to, but I wanted to share that I am an owner of a small business, and I love my small business. Today we got mobbed by the Enid Cash Mob. Thank you Enid. We are so supported here and have been since this whole time. I am unfortunately unable to provide health insurance and paid time off to my 35 employees in my small business. And if I had to exclude customers for wearing a mask as from my business alone, as the only one doing it in town, or one of the few, it's very difficult to want to exclude people from a place where I love customers and I love people coming in and gathering and having community. And if there was a positive case in my business, the health department calls the positive case and investigates the contacts. And the people who have been 6 feet or closer and have spent 15 minutes or more with that positive case would be asked to quarantine at home. This is a protective measure to help us make sure people get a test and know if they are transmitting the virus. So that would mean that a shift of my staff of 3 or 4 people would all have to stay home, and they would have to pull in other employees. If that shift were to increase to another shift, I would have to close down my business. And we are on a tight margin is what I'm trying to say. I did want to share, I've been sending occasional links to some meta-analysis and literature reviews in the chat, but I'm also going to share a reference to a study done by Goldman Sachs. And this study used information on the relationship between the time of closing, an effective lockdown date, and the effect on the gross domestic product. So the study demonstrates that shutting down a business has an obvious economic impact on our community, on my personal business, and that wearing a mask in order to keep a business open, in order for me to keep my employees healthy and safe, would keep me open and would ensure that our economy can keep running. I'd love to share the study also on Facebook. And I just want to give the perspective that I would love to give paid time off. I would love to give insurance. That's one of my goals. And for those of you who have that support benefit in your job or in your ability as a family to stay at home, that's great. You are going to be well positioned to manage becoming infected with COVID-19. Okay. But for some of my employees and for some of the people that we are calling from the health department as contacts or as positive cases, they're telling me, or not me, my staff, that if I have to stay at home, I can't feed my family next week. If I have to stay at home, I need my job. I can't pay my rent. So I just wanted to put the economic implications that wearing masks in my business. I would ask you as a volunteer in the meantime, whatever mandate comes out, if you wear a mask in my business, you're helping my employees stay at work, and you're helping our economy continue, and you're helping continue to stop the economic impacts. Please consider that 13% of our Enid residents are uninsured, and they could not pay for health care if they were to be hospitalized. So please consider they're economically vulnerable people as well.
Okay, thank you. Is Allison Burchett on the online? Again, if I call your name, go ahead and unmute. Oh, is that you?
Did you call Allison Burchett?
Yeah.
Okay, sorry. I thought on the forum it said that it would contact you if you'd been selected to speak.
Oh.
But it's okay. I drove here a few minutes ago, so we're good.
Okay. All right.
Earlier this week, I sent the mayor a letter expressing some of my concerns about continued large gatherings and inadequate contact tracing that's happened in our community. But I wanted to come today and speak to you all as an Air Force spouse. My husband is an instructor pilot at Vance, and we love Enid. We love Vance, and I often joke that the weather sucks, but the people are great. And I think we saw that really profoundly this spring when I got to be involved with the Enid Mask Force, and a group of church ladies and community members came together to make thousands of masks to help local businesses and organizations in the matter of 2 weeks. And it was the coolest process. I got to see people through a window, come drop off fabric, pick it up and cut it, bring it back sewn. And it was a perfect example of what Enid could be. I'm a lucky Air Force spouse in that I have a flexible career that I've been able to take with me as we've moved around the country. But a year ago, we had a baby, and now that career is dependent on my access to childcare. And we utilize childcare at the base, and I'm not sure if most people know, but the base is making regular decisions about whether to keep childcare available for Air Force, for people who are not active duty spouses and non-essential workers, so that would be people like me. And my concern is that if we don't do more to mitigate the spread of COVID-19 in our community, people like me are going to see things like childcare, our ability to send our kids to school diminish, which is going to negatively impact the income earners that are married to those active duty members. So I just wanted to share my perspective on that with you all and ask that you please consider the mask mandate. I think we've heard really good points on both sides today. I don't really want my postman to have to wear one, but I do think that there's reasonable ways that we can protect each other. And I don't think that when people join the Air Force or the Marines or the Army that they're doing so to protect our liberty so that we don't have to wear a mask at Jumbo. I think they do it for bigger and better reasons. So thank you for your time.
Good. Thank you. Okay. Is Nancy Presnell, P-R-S-N-A-L-L, online? Okay. Lori Bonnewell? How about Linda Hinkle? I'm sorry, Hinkle?
That's my official, it's Linda Sue name, and I signed up online because I thought it had.
Oh, okay, that's okay. No, that's quite all right. I thought I'd seen the same one, but I just want to make sure. Okay.
I have another turn now.
How about Leonard Gilmore?
Someone I know in this room was confirmed positive for COVID.
Wow. Leroy Watkins?
He said he passed.
What?
He's passing. He's good.
Okay. Mary Selzer? Come forward, please.
All down.
I want to thank all of you for your patience in enduring all of our comments. We really appreciate it. A lot of what I wanted to say has already been stated, but I'm a former pastor's wife. My husband and I pastored a church for nearly 3 decades in the Detroit area, and I'm also a professional leadership and team coach. So I've worked with a lot of people, and I'm certainly not a medical expert, but my concern is that all the indecisiveness about do masks work, do they not, and social distancing and all of that, that it has created a spirit of fear and confusion in our nation. And I think we would all agree that making a decision out of confusion or fear is not wise. So while the debate continues and the facts are inconclusive, it would be very unfortunate for this council to make a decision on behalf of Enid residents without consistent, proven information. So yes, people with compromised health issues should choose to wear a mask for their own safety, and they should avoid going out in public as much as possible. However, those of us who are healthy should not be forced, with the fear of being fined, to wear a mask when there's no consistent proof that wearing a mask makes a difference, and I think that's already been stated. So while the medical experts battle it out, I think we, the people of Enid, are intelligent and sensitive enough to decide individually whether or not we will wear masks. And personally, mask to me represents fear. I don't know if when I'm in the store and somebody else is wearing a mask, I don't know if they're protecting themselves from me or if I'm being protected from them if I wear a mask. And so I would hope that this council will trust us, the residents of Enid, to make the best decisions for our lives and community as much as you, the council members, would like for us to trust you. God has not given us a spirit of fear, but of power, love, and a sound mind.
Hey. I'm going to go back to some of the folks that have signed up in here to make sure we can keep them in here too. Karen Carter, are you here? Okay, Jody Schmidt? Yes, I'm here. Okay.
First of all, thank you so much for allowing me to speak. Wonderful thing to live in a country where I'm able to come up here and speak like this in a public forum without any fears or anything. But before I go any further, thank you. Thank you so much for taking the time and caring enough to come and speak your mind the way you did. So many people don't do that anymore. Friends, I tell you what, if you wear a mask, God bless you. I respect that. I respect your right to do so. If you want to do that, that's fine. But all we're doing here today, these folks here in the red, we're asking you to respect our right to say no. Number two, I work all over the place. I work in the oil field. I talk to a lot of people. I know people all over outside of Enid and everywhere else. And there's one consensus that you need to consider. Everybody I talk to, by far the consensus, will stop coming to Enid. They've already said, if you pass this mandate, they will go somewhere else where they don't have a mandate. I don't know if it be Alva or Fairview or wherever it be, but I can promise you there are a few people that are starting to grow some principles, and they're going to say no. They're going to say no, and I'm one of them. I live here, but I'll do what I have to do to go where it is. The last thing I'd like to say is respectfully, you, sir, are right. And you, sir, are right. We don't talk down. We don't shout down people. That's the tactics of the left. That's the tactics of the left. But I want you to know, these people here are what we call the silent majority. They're 90%, 95% of Americans, but they've been shouted down for the last 20 years. And they're finally here to draw a line, and I think they're saying we've had enough. I can tell you that I have had enough. These people are the church-going folk. These people are the God-fearing people. These are the people that pay all the bills. They go to work, they pay taxes, but they're getting shouted down by a few people that do nothing, do none of that. And I think the line's being drawn, folks. They've had enough. I'm your ally. I'm your friend, and I support you and you, sir. I'm a law-abiding citizen according to what God's law says. But I fear these people are forcing us into civil disobedience. They're forcing us to a place where we won't be your ally. We'll be your adversary, and I hope that don't come. We're all on the same side in unity as Americans, and I hope that stays that way. Thank you for letting me talk.
Lanita Norwood? Ah, you see?
All right. I am the minority here in many ways. But to me, masks equal love, and this is a problem I've had even at the church. And we say we love because God is love. And we have a member there that has cancer. And I can't love her enough to cover my mouth in case I'm asymptomatic. That's not love. That's not love. God is love. I pay my taxes. And I work hard. I work 2 jobs. But I began to think about this, and I began to think about Christians. Christians are the ones that crucified Jesus. They didn't show the love that they should have towards our Savior. And one thing that I was looking at when I hear people, I said, why are people so angry about a mask? Now, if you told me to get a shot every time I walked out the door, you'd have a problem. Or if you said, oh, you got to take the mark of the beast, I wouldn't march with you. And we'd march hard together. But this is a mask. It's not hurting me unless you have a disease already yourself. But I'm trying to protect someone in case I come around someone that's asymptomatic. I was looking at some quick little laws real quick. You have to wear a helmet to ride a motorcycle. You have to wear a seatbelt in my car that I paid for. You have to have a car seat for your children in my car. No shoes, no shirt, no service. Really? I have never heard anybody marching and wearing red and wearing big banners. No shoes, no shirt, no service. I have to have car insurance or I will get fined, or they'll tow my car in, or I'll have to have a big fine. No smoking in public places. I'm doing that because I love you. I don't want you to breathe in secondhand smoke. No urinating in public. I could go, guys go around trees. But if you get caught, you're going to jail. No alcohol while drinking and driving. No jaywalking. I can't even walk through because it's clear, no traffic is coming. I got to go to the light. That's my liberty, right? No open containers, no cigarettes sold to anyone under the age of 18. I can only buy 1 box of Sudafed, even though I might have to go out of town and I have a sinus headache. Is that taking away my civil liberties? A mask, I just don't get it. I've heard all the rhetoric. No, none of the people know, the medical people, this is new to us. Give them a chance, guys. They're going through, they're learning. Give them the learning curve. Don't beat them up. Give them the learning curve to get it right. They're still processing. They're still testing. But this is not taking away your liberties. Love conquers everything. Let's err on the side of saving someone's life. I've lost many people that have died to this COVID, not in Enid, but the first lady that died was a friend of mine. I've lost and I mourn my ex-pastor's wife in Mississippi. My bishop, him and his son died. Mothers have died. Grandparents have died. We just lost a 13-year-old girl in Lawton. And what if I would have been asymptomatic and been around that child and they got sick and their body couldn't handle it? Come on, guys. Love. God is love.
Thank you. Shanae Kinman. I hope I didn't butcher that too bad. Sorry. Shanae, okay.
Ooh, it's a long night. Okay, so everything that the world is saying is going against God's word. I stand with God's word. He said he's our healer. He's our provider. And this is fear. But perfect love casts out fear. So I choose to stand on God's word. I choose to stand on him because he did not die in vain. He did not die in vain. I'm a victor and not a victim. And it says United States of America. So we have to stand united. Because this is I'm sorry, but I am a believer. I'm not going to say sorry because I know the truth of God's word. And I love him. And I stand on the Bible. And they trying to push the Bible out, and they trying to push God out. And I want to stand on truth. So it's Jesus, I will stand with you. That's it.
Debbie Podol? I'm sorry? Poteet, yes.
Thank you so much for listening to all of us this evening, and I know this is a long evening, but I have a few facts here for you. This comes from the American Medical Association. It's face mask safety. Know the facts before you wear one. Number one, decreases oxygen intake. Breathing through a mask decreases the amount of oxygen we need to live and be healthy, increases blood acidity, and makes breathing difficult. Number two, it increases toxin inhalation. Toxins that we normally exhale as we breathe become trapped in the mask and re-inhaled into the lungs, increasing symptoms. Number three, shuts down immune system. Decreases oxygen intake, increases carbon dioxide and toxin intake, putting body under stress, releasing cortisol, and shutting down immune processes. Number four, increases virus risk. It encourages triggering an infection from dormant retroviruses already in the body, taking advantage of a weakened immune system due to mask wearing. Number five, scientifically inaccurate. Virologists measure COVID-19 to be 80 to 140 millimeters in size, making the weave of material mass to be the equivalent of a chain link fence to a mosquito. Number six, the effectiveness has not been studied. Absolutely no peer-reviewed studies have been carried out of mask effectiveness within a social environment to control, prevent, or eliminate the spread of disease. I'm 64 years old, and I have an autoimmune disease that I have fought for quite some time. A matter of fact, a few years ago, I wasn't even walking. And I actually go to a specialist in Texas every 8 weeks. That specialist, I have told him one of the things I'm now on is hydroxychloroquine, which there's a lot of controversy over. But the one thing he did tell me is I will not get COVID. And the other thing that is amazing is the fact that at the very beginning of this, our governor, he spent $2 million on bringing hydroxy into the state. And yet my husband, who has done some work for some people with a pharmaceutical company here in town, have said they've not been allowed to use it. And I have a brother that's in Oklahoma City, Integris Bass at this moment. Yesterday, I had a meeting with one of his doctors that came into the room. And he had a mask on, and as we stood there and talked, he pulled his mask down to speak to me and said, I'm not even really supposed to do this, but he said, I'll tell you one thing. He said, because we talked about kind of where we're at and what we believe. And he says, I know from the scientific things that I have seen and what I believe, he says, is I would rather my parents, my wife, and my children get COVID-19 than the regular flu. Because he said we have a cure for it if they'll recognize it. And he says it's a lot quicker to get over. Thank you for listening to me.
Okay. Aspen Masters. Okay. Ron Wade, if you're here, you're up next.
My name is Aspen Masters, and I am a licensed certified medical assistant. All of my notes were on my phone, and my phone actually died, so I'm going to do my best that I can to remember everything that I had on there. I'm in support of the no mask mandate, obviously, as my red shirt can tell you. Although in the beginning I was very much on both sides, having worked in a doctor's office with not only pain management people, anywhere from 19 all the way up to 65, who are also immune compromised and family practice. There's very conflicting studies on both sides of it, but from what predominantly I am seeing, not only through articles that people keep sharing through Facebook and research that I've done on my own, there's a doctor by the name of Jen Meehy, M-E-E, H-A-N, and he's an MD, and he published a very long article, which I actually sent to you, Mr. Mayor. I don't know if you took time to read it or not, but in there he touches on very different aspects of how masking a whole community is not really going to save anyone in particular, or even people who are asymptomatic of trying. They're saying that asymptomatic people are the ones exposing others and a chance of getting it. And he has put multiple quotes in there from other doctors and other studies showing that that is just not the case. I really wish I could read for you verbatim what he had, but unfortunately my phone is dead. There's been another doctor by the name of Victory Kelly. She is a disaster specialist. She's got a specialty in that, and she addresses how we as a nation have addressed this pandemic horribly wrong. You know, telling people to stay in their houses that are perfectly healthy to prevent someone else from getting it is just not simply going to work. Are we to tell her that she's wrong? YouTube apparently thinks that she is, because her YouTube video has been taken down twice now because she doesn't agree with the fear-driven agenda, and she tore apart this COVID-19 of what they've mangled it up to be. She said that 85% of people who even get the virus inside their lungs and breathe it in automatically kick it out, or they have very low symptoms and nothing that's even quite possibility of putting them in the hospital. The hospitalization rates are very low, and 2% of a death rate. While that's very tragic, how are we going to tell the rest of a population that we need to put a face covering over us in order to protect a wee little teensy tiny bit of the population? And yeah, that curve might go up in flu season because viruses live better in the cold. But we also are supposed to take better hand precautions, better washing our hands. We're supposed to be desanitizing things in our household. That's all things that we ourselves are supposed to do to keep ourselves healthy. But why are we supposed to be told when to do those things, or how to do those things, or that we must do those things? That is all something that we have to take responsibility for ourselves, not be told that we must do it. And that's really butchered of what I wanted to say. I'm sorry. I might forward you my notes later as to what exactly they said, but I appreciate you guys listening to me. I did want to touch on one thing that Ben said. He did say that I could tell he kind of got frustrated a little bit when he said that you guys were indeed the 7 voting on this subject. And while he is very true, and we don't actually get to put pen to paper to that, we also voted you guys in because we trust you guys. And we want, even though we both obviously are going to have different opinions, and we're going, you know, your medical people that you've handpicked and the medical people that I'm choosing to believe in have 2 totally opposing sides. Does that make them totally wrong? Maybe, maybe not. But no one's come out with conclusive evidence as to this is the one thing everybody should be doing. It's yet to be proven. So I just pray that even though through everyone's frustrations, that everyone is heard equally, and that both sides of the fence are weighed equally, and that this isn't, I demand my way and you're not going to do this, or I'm not going to vote you in next time. That's not what I want to portray at all. But I do want to sincerely you guys to listen to us and the population that do trust you and that might possibly vote for you again.
Well, I appreciate your comments, and that's why we're here tonight. That's why we're here. As to the email attachment, I haven't read everything. Since Friday, I've received 350 emails on this topic. Almost all of them have attachments, so I can't read.
It's really long.
No, but I haven't gotten rid of any of them. I plan to read every single one of those. So I do appreciate the comments everybody had.
Good evening. My name is Ron Wade. I'm a design engineer. I work out at Aircraft Structures at Woodring. I am also a volunteer assistant chaplain at the Medium Security Prison in Helena at Crabtree. as a design engineer, if you've flown on a Boeing 777 or a Boeing 737, you've flown on my hardware that I've designed. And as a design engineer, when we design a wing, we have empirical evidence with the strength of materials. We can calculate exactly when that wing is going to break when it's bent because of empirical evidence. And what I'm hearing today, and what I've read since the beginning of this, with CDC, I've heard conflicting evidence with regard to the effectiveness of the masks. Okay, if I want to do business at Walmart, now I'm going to have to wear a mask. Well, that's my choice. That's my choice. Okay, now, thank you guys for serving in law enforcement. When I go into Crabtree, I have to wear a mask. Now, I'm going in because I love them. I love them. I'm going in with rapists and murderers. But with a mask on, it's much more difficult for me to read what the emotional condition of that inmate is. And so, with the law enforcement, you are now putting them at greater risk. And remember, I'm a design engineer. I'm into risk management. You are putting them at greater risk because they, like me in the prison, are going to have a more difficult time reading the person that they pull over because they're in a mask, if you mandate it. Again, a back to choice. I want to read something. Hopefully it's a document that we're all familiar with. It's a very short portion of this document. But we hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among them, these are life, liberty, and the pursuit of happiness. I firmly believe that mandating masks, in fact, I passionately believe mandating masks is an infringement on my personal self-determination. I am type 2 diabetic, so I am at risk. But I choose when I have to, if I go to Walmart, into the prison, yes, I will wear a mask. But as you see, I am not wearing one. Lori went there earlier, and I'm going to go there again. My body, my life, my choice.
Okay, let me take a couple more. Those that are listening on Facebook, I'm going to read some names. If you're there, unmute your microphone and let us know that you'd like to speak. Katie Kittel. Okay.
Mr. Mayor, can you hear me?
I can.
Oh, this is not Katie. I apologize for butting in. This is Nancy Presnell. My name was called a little while ago, and at that time I could only get on via YouTube, and I could not respond, but I would like to have an opportunity to speak if that's okay.
Please go ahead. We have a 2-minute limit, but please tell us what you're thinking.
Thank you, Mr. Mayor. I know that, well, first of all, thank you all for having this forum.
Bitch.
Oh, wow.
I am speaking in favor of a mandatory mask act right now. A newspaper in Houston recently ran 43 pages of obituaries, and now our governor has the virus. Our local numbers are increasing
There's
rapidly.
going to be black people on that.
And there's common knowledge that there are asymptomatic and pre-symptomatic people walking around maskless. And whoever's saying obscenities in there, I really wish you'd stop it. Anyway, there are pre-symptomatic.
What you mean obscenities? I'm from Texas, where I fornicate my cousin.
Asymptomatic people walking around maskless and putting the rest of us at risk. And they say we don't want to live in fear. Well, no, it's not living in fear. It's about living to protect ourselves and other people's safety. Nobody gave anyone the right to infect others willfully and just claim that it's a matter of their freedom. Statistics are reported like there are only two outcomes, which would be death and recovery, but actually there's a third outcome, and that would be mere survival without anything close to recovery. Survivors are reporting weakness, continued chronic shortness of breath, permanent injury to heart, lungs, brain, other major organs. Some people have had to have transplants of major organs, and the list of lingering problems, permanent problems by survivors goes on and on. We're not even sure how it affects children long time. We're all intelligent people, and we need to listen to our medical community, not local evangelists, not state and national figures who haven't provided any leadership. Please enact a mandatory mask or face shield, public order.
If you
and
don't
please
wear a
take the
mask,
other
you're
steps
stupid.
that some nice person is really being obscene on here. Anyway, please make mandatory masks. That's all. It's not that big of an imposition. Either masks or face shields would be good. Anyway, please just do the right thing and try to protect the entire community. Thank you very, very much. I'm done.
All right, thank you. To those that are joining us online, please provide respect to the people that are speaking, no matter what side they're speaking from. If you have any comments and want to put them in the chat room, feel free to do that, but let's have some dignity here, please. Thank you. Next is Michelle Baldwin. Okay. Christine Hopkins. No, I don't think that's one. Kenneth Blazer.
There's a Christine Dawkins that is here. Let me see if, is that the right name?
Well, it says Hopkins, Hopkins, and they have a email spelled out with those same letters, so I don't think that's the same person. Richard Taylor?
I'm here.
Okay, sir. You have 2 minutes. Tell us what you think.
Oh, excellent. I'm coming from Enid Home Finders. I'm a property manager. My main problem is when you mandate this, if it is a mandate, businesses cannot be in the policing force for the city of Enid mask ordinance. You know, how are businesses realistically supposed to enforce an ordinance on mandatory face masks, which could be dangerous confrontations with the public or without locking our doors? That's a question for anybody. How can we enforce your mandate?
Okay.
Hello?
Well, I can hear you, but we're actually just kind of taking comments now. It's not really an interchange. We're trying to get all the ideas first, and then we'll start looking at solutions and how we're going to do that.
Actually, that's all I have. I understand both sides. I do. And I just want to know that I do not want to get into a fist fight with somebody coming into my office.
Okay.
And so I just want to know how they propose without putting a policeman or a sheriff in everybody's business to enforce anything that you all decide needs to be done.
Okay. All right. Thank you.
Mayor, this is Brian O'Rourke. Can I interject?
Okay, Chief, go ahead.
The way that's the exceptions are written, it's basically sort of unenforceable, and it's difficult to enforce. And my personal opinion, and I'll put that out there now, is that businesses probably should have the right to do what they want to do. With all the exceptions, it's really tough for our officers to enforce it, and I really don't want to put our officers in that position.
Okay. All righty, thank you. Sarah Hanlon. Oh. Thomas Eckert. Deborah Ruthenberg.
Can you hear me?
Yep, go ahead.
Okay, I want to say that I am in favor of not mandating masks. People can do what they feel is the right thing to do. I'm 68 years old and I don't get out much, but I will wear masks where people have asked me to wear them, and but I just don't think we should have it mandated. That's all I need to say. Thank you.
Amy Russell.
I'm here. You hear me?
Yeah, go ahead.
Okay. I'm in favor of the proposed mask mandate. I'd love to say shop with less fear, but some would say that if I'm so afraid, I should stay home. So please, at least help me be safer at home. When discussing these potential mask mandates, please remember renters. If a homeowner who's being particularly careful about COVID needs a plumber or exterminator, they can seek out one who will mask. Renters have no such option. I can put a note on my door requesting masks inside, but I don't have the authority to require it. You, the council, do. I hope we mandate masks for this indoors for the safety of our citizens and the preservation of our medical system. But if nothing else, please help people to be safe in their own homes by mandating masks for workers who come in. Thank you.
Okay, thank you. Cheryl Cooksey.
I'm here, Mayor. First of all, I want to thank the city council members and the mayor for providing this forum. I too am in favor of the mask mandate. It has been recommended by our governor. It has been recommended by many, and yet 90% of the people I see in the stores do not wear masks. I am going back to school in a few weeks, and I'm going to be around a lot of students, and I hope and pray that you will truly consider mandating masks in Enid, Oklahoma. And thank you each for all of the service that you do for us.
Okay, alrighty, thank you. Bruce Kane. Okay, other folks, these are folks that signed up here. Del Rey Kramer.
I also want to thank all of you for being here tonight and listening to all of our concerns. I agree with everyone who showed up and read tonight not supporting the mandate, so I'm not going to reiterate a lot of what was said, although those were a lot of my points. But there was just a couple of things that I did want to mention, and one is in regards to, I believe it was Maggie and the small businesses in this town. I too have been a small business at one time. I'm not anymore. But I just wanted, and I'm also from outside of town. I'm originally from Lahoma. I live 2 miles outside of Enid right now, but I'm here every single day. But I have a lot of friends from outside of this area, and every single one of them have told me that they will stop coming to town because there are grocery stores in Hennessy, there's some in Ringwood, there's one in Fairview. There are little towns around here, and it is going to take away business from our small owners, not just grocery stores, but anything. And, you know, I guess the point I want to make on that front is that there are more than one ways to kill the business. And I fully believe that mandating this mask is going to shut down some of the small businesses in this town because people from outside of this town are not going to be bringing their business here anymore. And that is a huge concern of mine. The next issue, I guess, is probably the last one. You know, the purpose of this meeting is for the town to come in and express our concerns to you so you guys can hear us. I know that the vote is coming down to you 7. It is what, almost 8 o'clock, 7:45 right now. Online, I've not seen more than like 94 people on there. It's went up and down from 70. Right now it's at 84. This room, I believe, holds more than 100 people. 120? Is that what it is? Until 7 o'clock, this room was absolutely packed. And the community consensus that you have heard from all of us here tonight is that we are not in favor of this mandate. Out of all of the speakers that have signed up to speak and that stayed online and, were here, you've had a total of like 7 that are not in favor of this. I'm just asking you respectfully to think about the community that has shown up tonight, because these are, like another one said, the silent majority. We are the ones who care enough to be here. We are the ones, who are spending not that everybody doesn't, but like we are the ones who care enough to be here. We are the ones who show up at the polls to vote. I just respectfully request that you take all of that into consideration. The amount of the community members who you did see show up in favor of the mask versus those of us who have spoken who are not in favor, because that is going to be your overall consensus for how the community feels about this issue. Thank you.
Mr. Mayor, can I make one quick point?
Yep.
So for those who don't know, I've been tracking, I watch online as these go on. We also post this on Facebook. So I want you to know you are also in a conversation with 1,700 other people inside the city of Enid who are also watching this. So this is big, and everybody's paying attention to this. And there are some people, and with respect to what the last person said, I'm lost, I don't see it here. Oh, with respect to what you said, there are a lot of people who just couldn't be here, but their voice is just as important as everybody's in this room. So I just want to make sure that we show the respect to everybody in the community.
Yeah, good point. Thank you. Tara Cooper. She had to leave? Okay. Shelley West. Okay. Scott Jessen. Oh, yeah, okay. We had you on both lists there. So we charge you twice, I guess. Let's see, Tina Parker, Trista Parker. Janet Peck. Ken Blazier. Donna Pettibone. Yes, ma'am.
Good afternoon, Mayor. I just wanted to come in and say that, tell a little bit about myself. I have diabetes. I'm high risk. I do not wear a mask. The reason I do not wear a mask is because I have claustrophobic, and I'm trying to represent a population that's not here with mental health issues. I was raped at age 17 by 3 men. And when I put a mask on, I feel like I'm getting raped again. So I just want you to take into consideration the population that have PSTD, that have had issues with rape victims and things like that, that it's hard for us to wear a mask. I wouldn't be able to go shopping if I had to wear a mask. My daughter also has issues. She has diabetes. She has HP. She wants to wear a mask, she thinks they're cool, but I don't make her. That's her choice. If she wants to wear a mask, let her wear a mask. But I can't. So that's basically what I wanted to say. They say that there's, like you said, people don't care enough to be here. It's populations like me that are afraid to talk about what we've been through. So they won't come. I'm a Christian. I'm not afraid to die. I was just recently very sick. I had a fever, bones ached, everything. It wasn't COVID-19. It was some flu, but it was still pretty big. I mean, it lasted over a week and a half. But so I'm just letting you know that I'm not for wearing masks. Thank you.
Herbert Freeman? Yes, sir.
All right, this is the first time I've ever been to a town hall meeting, and I've been in this town for about 30 years now, and I never really saw a point of going to one until now. I'm against this mask ordinance because I have trouble breathing. I have breathing problems. And I had to do a service call yesterday at Voltec, and they make everyone wear a mask while you're in the building. And I do roofing. And in one of the areas, I had to go check a leak. There was no AC, no air conditioning. I was in there for 5 minutes. It was like 95 degrees. And after 5 minutes, I felt like I was going to pass out. Now imagine being on the roof where it's 110, 120. On top of that, another few more degrees because it's the roof. It's going to be hotter. No shade, no anything. Imagine a crew like me wearing a mask and we pass out or get ourselves hurt or fall off a roof. Who am I going to go to after I hire a lawyer? You, or any of you for passing this bill? It's unconstitutional in my opinion, and it's against people's rights. And I refuse to wear a mask if you pass this bill. So. I support you. I've always supported law enforcement. I got family in the sheriff's department, and I support them too. Even when I did stupid stuff back in the day and I was arrested, I still supported them. But I've learned, I've grown, I've learned. That's the way of life. And I say to you, I'm not going to hold against you, but I will not wear a mask if they pass this bill. And if you arrest me, I'm not going to hold against you because it's going to be on them. I am not going to risk my life on top of a 4-story building or a 3-story, not even 1-story house, or the safety of the people I work with because you fear this COVID-19 that has been played out for so long as a political game. And as for the mask, it don't work. The way I see it now, it's nothing but a fashion statement, as you can see right there. I mean, come on now, it doesn't work. And one I've read on the internet that actually works is the N95. And who can actually get those? But okay, that's all I got. Thank you.
Nick Celebrity? Brody Roestall? No?
I'm not a good speaker, pretty nervous. It's going to take me a lot to get through this. My name is Brody Ronestall, and I own Brody Ronestall Electric here in town. To the lady that was talking about contractors coming to their house and you guys protecting her and her home, if she asks us to wear a mask, we will wear a mask. That is her choice, her home, her rules. That being said, anybody that works in construction already knows it's hot outside, it's dirty, it's hard enough. It's hard enough not to have to wear a mask all day long. We wear them when we need to. We take them off as soon as we're done, they go in the trash. There's a million reasons to wear a mask, and there's a million reasons not to wear a mask. But I don't hear choice in this mandate at all. It is a choice. It is our choice. Let us have that. There's a lot of things been taken away from us in this world as of now. Don't take another. You know, our kids have a hard enough time. Got essentially expelled from school because of a virus, now what? Now what? They're going to be playing outside with their friends, 3 or 4 of them. I'm sure these officers won't do that, and I have full faith in them. They probably won't. And like your command officer said, I guess, it's going to be hard to enforce. That's my point of view. That's only my point of view. I'm sure a lot of you have other points of view. I thank you to the people that came out for it. Thank you to the people that came out against it. That's the beauty of this country. We have the right to do that. Me personally, I'm not for the mask mandate. But if we're required to wear it, I'll obey the law. If I get caught obeying the law, I'll pay the fine. How many people out there can do that? I can. I'm a business owner. I do okay for myself. My guys do okay for themselves. But if you keep finding them and finding them and finding them, at what point are you going to come after me? Because they can't pay their fines. That being said, I'm not for it. I appreciate your time. Thank you. Have a good day.
Okay, that completes everybody that was signed up. Pardon me?
Is it possible you skip some names?
I don't think so, but if you would like to speak, please come forward. Okay. Did you sign up on?
Yeah, I
out here?
signed up like 115. I was behind like Melissa earlier. I thought I was on the first page there. It doesn't matter though.
It's okay, yep. Yeah, no, go ahead and talk,
Okay.
please.
My name is Nick Henry, former T-38 instructor pilot, airline pilot now. And, most stuff I wanted to say has been said about liberty, Constitution, and all that. But I do remember the experts, Dr. Fauci, in January and February telling us, you don't need to wear that mask. Go out and live your life. That mask, only wear a mask for healthy people. So for all these experts, so-called experts, that have done all of this their whole life, doctorate degrees in all of this, to not know? Really? So in January, February, they didn't know. Spring break, we go to Florida. We're going to go to Disney World. The day it closed is the day we had spring break. So it's like a switch has been flipped. And so these experts, and it just looks like to me that all of a sudden the mask is the end thing. And life is not about risk. As a pilot, I know this every trip. Sitting in front of a metal tube going 500 miles an hour is some serious risk, but I'm willing to take it because I'm called to be a pilot. And so you can walk out just last Saturday night. Walk out, go get your mail, and get killed by a hailstone here in Enid, Oklahoma. So life is not without risk. And did you know, I looked up the numbers. Mr. Rozelle, are you going to call for eliminating automobiles? Because guess what? We've had 2 deaths due to the virus. We've had 3 car accident deaths here in Garfield County. So you are more likely to die in a car wreck than... And then there were 6 from the flu and pneumonia. Every year, people die of the flu. So sadly, but life goes on. Let's rock on. Let's press forward and live your life. No mask. No mask.
Yep, come on up, or you're up next, okay?
That's mine too. My name's Marvin Main, and I know everybody here is quite familiar with Will Rogers' statement is liars figure and figures lie, but I just wanted to bring up, compare the United States with other countries in the world. India has a population of 1.36 billion, in the U.S. 3.28 million. India has an area of 1.269 million square miles, and the U.S. has 3.797 million square miles. The death toll in India from COVID-19 is 24,309. The death toll in the U.S. is reported at 137,000. Means a country with people packed in at 1,071 people per square mile has a death rate of 0.000178. of its entire population. The U.S. has a death rate of 0.0471% when we only have 1.157 people per square mile. They have over 1,000 times people per square mile than we do, and their death rate is a sixth. Now, what would cause that? Let's see how India handles their COVID. The number one way that they have done it is advertise to improve personal hygiene. I've heard one person tonight mention that. None of the healthcare professionals mentioned it. The second thing that they do is they avoid crowded public places. They avoid physical contact with tourists. The third one, they avoid consumption of raw or uncooked meat. Then we get down to number 5. They wear a mask when in public places. That's only 43% of them do that, but yet they have a death rate 1/6 of the U.S., and they have over 1.6 billion people. So, as Will said, liars figure and figures lie, but these are facts published by the World Health Organization. Thank you.
Thank you. Yep.
Thank you all. I was at home watching this with my husband. I kind of thought maybe we that are for masks were a little underrepresented. So I told Buddy, I'm leaving, I'm going up there. I haven't heard much about compassion and empathy for people. Yesterday, I had to go to Stevenson's Cancer Center because my sister was going through her last chemo. Each time she's had to go to a chemo session, she can't leave her hotel. She takes cleaning products, cleans her room, and takes her own food. When this all started, they found out that I have myelodysplasia. I have yet to see my oncologist because they're not seeing patients, but it's a precursor to leukemia. I didn't get to go to lunch today with some friends because one is going to a casino. I'm not saying lunch is a big deal, but when you stay in the house all the time, and as Mayor Pankinen knows, with Buddy, it is a little stressful. But we've got to consider it's not about our personal freedom. It's not about fear. I don't fear this, but I do respect it. And I do respect a friend of mine has COPD. And then also out at the base, we have to wear masks to the commissary. They did finally let what they call we old people, risk people, have the gym from 9 to 11. So we get to have that. It's not that bad. I mean, I can't see me, I'm not out in the public all the time. I am retired, but we have to respect the people around us. We don't know. Nobody looking at me would know I have a precursor to leukemia. I look pretty healthy, but I am 71, and so I've known George for a long time. I appreciate everybody listening to this tonight, but please consider the fact that it's not all about our personal freedom. My sister's giving up her freedom. I'm giving up my freedom. I'm probably giving up some friendships because they think I'm a little too stringent. But that's my choice, and it's everybody's choice, and hopefully we can just all get together and live together and make this work. Thank you.
Thank you.
Hi, my name's Destiny Odell.
I've been here this long, I thought I can't leave without saying something, even though I didn't plan on it. I live a healthy lifestyle, and I really feel with every fiber of my being this goes against what is healthy. We need to be able to breathe. I think about my son going into the school this year. I can't do it. I can't put him in an environment like this where we fear a virus. We should be preaching personal health. I don't understand why we're not talking about proper nutrition and hydrating ourselves and like stop eating out and all this stuff. Like, it doesn't make sense. Stay inside, cover your face, don't breathe, like suppress your immune system. That doesn't make sense to me. We should not fear this. We should be tackling it. We need to take care of our bodies, not like cover our faces. And it's just ridiculous. And I just don't know, but this is wrong. I thought it was wrong since the very beginning, and I moved here 3 years ago from Oklahoma City, and I wasn't sure about this town, and then Corona hit, and I thought, you know what? I've never been more proud to be in BFE, Oklahoma. This town has been so chill about it. It's been great. I'm now like, I love Enid. I'm so happy to be here. But if you mandate masks, that just would crush my whole world, my family. It's wrong. I think it's not healthy. It's not good for us. It's doing the opposite of what we should be doing. Thank you. No.
Are we ready for us now?
Well, in just a minute. I want to see, is anybody else that didn't get a chance to speak that thought they signed up, or please come on up?
My name's Ron Licklider, and I'm 80 years old. I'm a perfect candidate. I've had cancer. I'm an insulin-dependent diabetic. The only thing I got to worry about is dementia and the rest home. I would like to ask the mayor and the councilman, are those masks disposable?
Nope, but I wash it every couple of days.
I can't hear you.
No, but we clean them.
You use them again?
Yeah, we launder them and then use them again.
What is your regimen of sanitizing those every night?
What's the line of questioning? I mean, what are you trying to get at?
How do you sanitize them? I mean, those things are loaded with germs. They've been on you all day, and you've been all around the public that can expose you. My point is, I am sick and tired of the city council telling me what is best for me. Because I bet there's not a person here that wouldn't say, you know, the city council in Enid, Oklahoma, the mayor and the manager of the town haven't made some pretty crappy decisions. You know, look at the hotel that's not finished. Look at the canal that the Corps of Engineers built that gave you money to clean it, and it's sitting there full of weeds and probably 6 feet of silt. The Army Corps of Engineers say if we have another rain like 1973, there'll be water from Cleveland and Oakwood clear to Cutbirth. They'd be having a foot of water in there. That has nothing to do with whatever you're worried about. I still do some work for people. I have a mechanic or a person that is a vendor that does work for me that lives in Newcastle. So last Thursday, I was driving to Newcastle, and I heard on the news that wise city council in Norman, Oklahoma, demanded that they start wearing face masks the next day. I had some product that I needed to buy for finish my job. I said, for GD, I'm not going to spend a nickel in Norman, Oklahoma. I'm not going to go to lunch there. I can buy what I need in Chickasha, in Moore, in Pauls Valley, Oklahoma City, anywhere else but Norman. And part of the Norman's problem is the University of Oklahoma, which I graduated from, and they are behind all of this, as in Boulder, Colorado, Austin, Texas, and most university towns. I have told where I graduated, you don't need to be asking me for money anymore. You don't need it. You're out teaching those kids to take over us. I hear all these platitudes about, oh, we got to look after our fellow man. You're in the service. You looked after your fellow male. Does anybody ever tell you, oh, you need to have been in the service to look after your fellow man? There was an article in the paper this morning about somebody that had a medical title that was about 8 words long, and she had that disease where you cough. I don't know what it is, emphysema. And she was wagging her finger the very idea that we don't take our fellow man seriously. I says, if you have that disease, stay at home. I'm 80. I've had all these things. I ain't going to stay at home. And I just challenge you, you people, Mayor, I'm going to pick on you. You're wearing a device that's supposed to be safe. I bet if they took a microscopic exam of that mask you're wearing, it would be loaded with germs and virus and what have you. I thought the main thing that we had against, to guard ourselves against it, was the wind. And Oklahoma has plenty of it. On any given day, there's 20 knots. And if you are sitting around with people, there ain't going to be any transmission. In Europe, they say it's not 6 feet, it's 3 feet. We hear so much from science and from the news media, politicians, about what's better for us. I don't know what's best for you. I wouldn't intend to presume that I knew, you really ought to do such and such and such and such. And it's because I love you, man, that I'm telling you how to live your life. Thanks for hearing me out.
Okay, I think we've covered everybody unless I missed anybody else.
I got a few questions first. Yeah, just ideas that you guys have to, if you decide to mandate, things you have to come up with to counteract the anyways. I'm not good at public speaking, so first off, if you are going to mandate, are you going to require a certain type of a mask? Or are you just going to be able to make your own mask, put it on, wear it? Second thing is, with me, I've spent 15 years in the oil field. I'm HSE certified and everything. I couldn't be going a lot of wells and stuff because, come to find out, I've got a bit of claustrophobic with masks and stuff. And with beards like this, no mask is safe. I mean, period. It doesn't work. So you're going to mandate for people to have to shave their faces to wear them? Because that's a big thing. I mean, if it's to protect everybody else, and I got a big beard like this, the mask does nothing, period. And the third thing, I've been trying to find more research on it, but people with concealed carry permits, as far as I knew, it's a federal regulation against covering your face while you're doing a concealed carry. How is the state of Oklahoma going to cover that? Or the city of Enid? Or because as far as I knew, state rules couldn't overrun federal rules unless it was declared under martial law. So that's all I had to say. Thank you.
Okay, thank you. Okay, Commissioner Norwood asked to speak for a moment. Got in first.
I thank God for each and every one of you all in here that came out, all those that are on social media and online. To God be all the glory and the honor. As I begin, I'm gonna make this short, but I want to quote a scripture that Jesus has spoke, quote unquote. In the King James Version, the quote is found in Matthew chapter 12, verse 25. And Jesus knew their thoughts.
He was just getting started, man.
It won't take me long.
No, that was the last speaker. Go ahead.
And Jesus knew their thoughts and said unto them, he's speaking to his disciples, every kingdom divided against itself is brought to desolation, and every city or house divided against this shall not stand. We profess to be Christians. I heard many times, I don't know. We don't know. We don't know. Absolutely, we don't know. But God, He knows. God knows. Let's be careful. Let's be careful in what we profess, because God is watching us. The Lord is listening to everything that we say. This war that we're in, this battle that's going on, is spiritual. This isn't natural, but we're warring flesh against flesh when we need to fight the spiritual. How do we fight the spiritual? God has given us weapons of warfare. But what has happened is the enemy has come in, and he's come to seek, devour, and to destroy us with racism, prejudiceness, hatred, bigotry, emulations, devastation, fear. Satan is on his job. And if we want to survive, we got to seek God. And when we seek God, and we decide that we want to turn from our wicked ways, the Lord said, I'll hear you from heaven, and I'll heal your land. Why am I speaking like this? Because I'm a preacher. I listened to everything that was said, and I prayed, and I said, Lord, give me what to say. And what God has given me to give to you and everyone that's listening, it's not about flesh and blood. We're all the same, whether you like it or not. I was in a biology class in college, and the first day we were in that class, the instructor was a white man. And he said, every one of you all that are white, raise your hands. And they raised them. He said, if you go back 8 generations, you got some black in you. He said, I can prove it. We were all created from Adam and Eve. Every last one of us. It's not about the left or the right. I get tired of hearing that in the media and on TV. We can't even talk about Crips and Bloods because we act just like they do. But we do it politically. But let me tell you something. We need each other. No matter what. No matter what, we need each other. We don't have the answer. But God, He does. In America, we have to come together. Because as long as we're divided, all Satan is going to do is just throw little things in our way to blind us. And once we get blinded behind these foolish things, the Bible said that he's going to come in unaware when the strong man has been removed. We got to keep our focus on God. We say, well, why is this about God? Then stop spending his money. Every time you pull out a credit card or you use some type of device to pay something, or you look at dollar bills, $100 bills, what do you read? In God we trust. When we say our national anthems, what do we speak about? God. We can't use God when we want to and shelf him and then call on him when we need a little bit of help. That's hypocrisy. That's right. So what I'm saying tonight is, let's not be hypocrites. Either you love God or you don't. And I will say this, and I won't say anything else. The Bible says, if you hate your brother, I'm your brother. I'm your brother. I'm your black brother. From a different mother. But I'm still your brother. And if you hate me because I'm black, or I hate you because you're white, I'm a liar if I proclaim to love God, who I've never seen, and hate my brother that I see every day. That's hypocrisy. I said I wasn't going to say anything. But I want you to know I had to say something. We don't know. But guess who knows? God knows. And we professed and said that we're all Christians. You cannot be a Christian and love who you want to love. You got to love everybody. Because Jesus said, love your enemies. So if I'm your enemy and you don't love me, you don't love Christ. And you know what? Whether you love me or not, I love you. You know why I love you? Because I want to go to heaven. I want to make heaven my home. And if COVID take me out, so be it. If a car wreck take me out, so be it. If a criminal take me out, so be it. But one thing I want you to know is that I want to make it when it's my time to go. And I want to try to do all I can to help all those that I can to make it. Satan is deceiving the whole world. But it's time that the church go back to church.
All right. All right, we've been at it for almost, 3.5 hours? I'd like to take maybe a 15-minute comfort break, and then we'll reconvene. If you all want to come back, you're welcome to do it, but we'll start doing the business of the council when we come back. So let's all get back in here at, let's see, 8:30. If you can get back at 8:30, we'll move.
Yes.
Thank you. I'm sorry, didn't speak into that. We're going to take a small break till about 8:30 here, take a comfort break, and we'll be back. do next is let each one of the commissioners give a say, just general
If we
comments.
have to, or we could ask for a motion, either way, oh my God. I assume it's
And then I don't know, would you like to take a look at the draft and see? I keep.
I have a feeling.
No,
Yeah, but I don't, oh, geez.
That little
Let's not talk about it. Let's get them
and they must have missed the amendment that gives
consider it
the
again.
right
and
to
all
state the protect public
again.
health,
Oh my
because that's in the Constitution too, but
I mean,
I'm not gonna let that center in this conversation.
I mean,
No one's listening to it.
I don't, I mean.
There was a lot of.
Yeah.
So much.
Came along the way.
And I didn't get up and yell at anybody.
But I didn't know. I was glad you didn't ask. That would get them started. Let's, thank you very much.
I'm trying to figure out where to go from here.
Well, you could say, are we ready for a motion or do we all need one? I know, you know, I would assume Ben's gonna jump on service now.
Yeah.
But,
Okay.
yeah, okay. Enjoy. I know she's laughing at me and my mask, but she doesn't know I'm wearing the mask so that other people won't get sick, and I'm wearing the mask because Larry is watching. You know, I realize I am a horrible mask wearer. Hopefully Larry doesn't see you right now. Well, yeah. He usually says that I am not visible, which is fantastic. Fantastic, but I'm a little visible.
I can see you.
Yeah, I know. Who is that woman?
Okay, we call the meeting back to order again. I appreciate the input from all the people that came today, as well as those that participated online. That's the reason that we do this. That's why our government is like this. We really did want to hear what everybody had to say. And so I appreciate everybody being involved in that process. This is the way it's supposed to work. What I'd like to do now is give each one of the commissioners a chance for a few words if they want to say something. We're not running for re-election here, so we don't need any 30-minute speeches. But if you got a couple minutes, 2 or 3 minutes worth of stuff that you'd like to highlight before we get going for the rest of the session, then we'll do that. So let's start with Jerry. You want to go first?
All right.
Mr. Allen?
Absolutely. Thank you, everyone, for participating and being here online or whatever form you participated tonight. I will say the same thing I said last time that I had to make a vote like this. I am voting for what's best, in my opinion, for Enid, Oklahoma. I'm not thinking about Lamont. I'm not thinking about Memphis. I'm making a decision tonight for Enid, Oklahoma with the information that I've been given. Thank you for your participation. Thank you.
Okay.
I've already spoken.
Oh, did you?
There's some call-ins that want you to give us another version.
All right. Ben, are you on?
Sure. I would just ask that we weigh the advice of the public health experts greater than our own discomfort, greater than our own uncertainty about the efficacy even. I think the efficacy actually is pretty well of general use of masks. I think there is consensus among public health experts. And I think Lenita said it really well. I don't think I could say anything better than Lenita Norwood did. Whatever she said, that was great. She's 100% right. This is what we should do to love each other.
Okay. All right. Thanks, Ben. Mr. Waddell.
I just want to point to two things. The first things is that there weren't just some cherry-picked professionals that you heard early on, medical professionals. You heard the healthcare leaders in the two major hospitals here in our community. And the consensus from both of your hospitals was this: the future, we're facing something that's going to get increasingly more difficult. And if we don't do something to make a change, it's going to be hard for them to be able to do what it is that they need to do in order to be able to care for us. This isn't somebody from DC. This isn't somebody from Arizona or Florida. These are healthcare providers from right here in Enid, Oklahoma. Your public health for Garfield County has told you that this is something that they recommend that we do. If we get to that point, the thing is that we need to understand this. It's not just COVID. If COVID fills up some beds, that's a problem. But we still have to do with the car wrecks that were talked about. We still have to deal with the flu. We still have to deal with the heart attacks and the stroke, everything else that comes along with it. And if we get to a point to where we don't have the ability to do it locally here, we've also been told we don't have some anywhere else to send them. That's a systemic problem that we have to take a look at and figure out a way in order to be able to fix. The second thing is this. We have this massive airfield that's back here behind us, Vance Air Force Base. And they have all of these guys who wear flight suits and fly in planes. And if our hospitals don't have the ability in order to be able to treat those pilots if something happens because we haven't taken the proper precautions in order to be able to keep the right amount of professionals and the right amount of beds, understand that we put ourselves in a position to where that becomes a part of the calculus when we make those calculations later about where this is where Vance needs to be. That's all I have to say about that.
Okay. Commissioner Stallings.
I'm going to be short. I would like to say that I got about 150 emails and phone calls and texts in the last 24 hours, and I'm sorry if I didn't return every call and I didn't respond to every text, but we do appreciate the input. The one thing that was really interesting to me, we've never had a situation like this where we got this kind of feedback from you guys or from anything near this. This is much bigger. But everybody, if you come read my emails, everybody says they make their case and then they're polite. And that's kind of, that makes you feel good. Even, they may not agree with me, they probably don't know how I feel about it at this point in time, but they were all polite about it, and I really appreciate that. So, glad you're here.
Mr. Mason.
I too would just like to say thank you for being here. I just think it's democracy one-on-one when every one of us get to come in, state our views, give our opinions. More importantly, though, I want to thank you for being courteous to other people tonight. I noticed after one little incident that following that, we even clapped for those people that had different views. I think that says a lot about our community. It makes me very much proud of where I'm at, where my family lives. And I will say that when I was appointed to council a little over a year ago, that I thought the largest issue I was going to face was the Call Water Project. And I will say I still think it is, because this one to me is a no-brainer. I've done my research. You can read everything you want to online. At the end of the day, I pick up the phone and I call the docs locally that I know. Say, tell me what you're seeing, explain it to me in a way that I can understand. They are not concerned. There is plenty of capacity. And I do not make my decision on emotion, ever. I don't think it's a constitutional issue. I know some of you disagree with that. If 2 weeks from now it looks a whole lot worse, I may see that totally different. I'm going to let you know that right now. But more than anything that I'm concerned about tonight is that the passion that I've seen with this group and all the red shirts, I mean, you're to be commended for that. I've known since Monday, I was in Dallas, but I've known since Monday that this was going to be a very interesting meeting tonight because my phone started blowing up. I had over 100 phone calls and almost 200 emails while I was down there. And I could see the passion, not just in your, or hear it in your voice, but in the emails, I could tell by the bold areas and the triple exclamation marks, as though possibly I wouldn't understand why you put it in bold. But I do know that you're very passionate about that. But what I don't want us to do is leave here tonight and forget that we can use this passion for a lot of other good things. Right. There are kids in this town that we have not solved the issue. They're going to bed hungry tonight. So when we leave here and we swing by Brahms to go get some ice cream, I want you to think there are kids that are not going to be fed tonight. We can take this energy and this passion and we can use it for something else. So when tomorrow comes and this gets passed or not passed and it's all over with, let's not lose sight that those kids are still hungry, that we still don't have a youth center funded here in our community. So the next time we send out an agenda and we start getting comments, oh, it's already decided because they've already typed it up, what that tells me is you haven't looked at the other agendas in the past, because the open meeting law that we have to abide by, we have to us tomorrow. So let's not lose sight of something good come out of this, really good. All right? And there are no conspiracies going on. I guarantee you. I would encourage you actually to get off of Facebook. All right. All right? Thank you. That's all I have, Mayor.
All right. The pastor wants a redo. Since he did the sermon but didn't really get to talk about the issue, we're going to give him a second chance here.
Quickly, all I really wanted to say is that we just have to be responsible. You know, do what we were told when we were children, growing up in school. Wash your hands and, you know, brush your teeth and, you know, good hygiene and all these different things. We need to be responsible. I wear my mask out of respect for others and out of love. I do it. It's not a guarantee that it's going to keep me safe or not keep me safe. Only God knows. But I'd like to say that we have a great, some of the greatest guys I've met. This is a very strong and powerful group of councilmen. And we really love people, and we come from diverse backgrounds. And, you know, I heard the comment, we voted you in, and, you know, might as well just say, we'll take you out. But, you know, can I tell you all something? We're not getting paid for this. And those that said that, you know, you wouldn't want to be in my seat tonight. So we don't get paid for this. We do this. We're in this position because why? We care about you all. And we love you all. We are not your enemies. We're your best friend. And we're here to make a decision. I'm going to be honest with you. I lost sleep last night. And I got up this morning and I said, Lord, I need your help. Why? Because I care. He cares. The mayor cares. Commissioner Waddell, Stallings, Mason, they all care. We're not, Gerald, the city manager, Carol, the city attorney, we care. The officers that are here. You know, our assistant chief, I thank God he was here to bring things back in order. You know, the ministers unto justice, unto God. He stepped up. So we care. Ladies and gentlemen, we care. And you know what? You all care. I actually enjoyed this. Before I got here, I was like, oh man, a long night. Here we go again. And I told the city manager today, I said, Gerald, I think this one's outdone the arts project, you know, the controversy of the arts project. But guess what? you all care. And like Commissioner Mason said, he said, hey, get involved. Keep coming. You know, we need this type of energy. We want Enid to be a lead city, you know, for the United States of America. Why? Because we care. So if you want our positions, fill the seat. They're not going to get paid. I mean, we get, what did Commissioner Starr say, 120-something emails within 24 hours? I mean, man, just think about it. Those that are married, you know, their spouses have to deal with that. That's time away from your children. All the reading and research. There's a lot to this. Why? Because we care. So what I ask before we vote, that everybody pray that we make the right decision.
Okay.
And one last thing, and I will say one last thing, and I want to bring this point out. There's already a declaration in order. The order has already been set. There's a declaration, and if it has to be changed, it will be changed. There's order already set. Just abide by the order. Done.
Okay. All right. I guess we have a draft proposal on a declaration, and I know everybody's had a chance to look at it, so I guess what I would do is see if anybody's interested in either amending or making a motion to accept or reject or whatever.
I'll make a motion to approve this draft declaration. I expect that if this passes, we're going to have cause to tweak it and to revise it. And if this does pass, I invite the community to, where it's working, let us know. Where it's not working, let us know. That because so much has been dumped in the municipality's lap, which really hasn't been in the past, we're having to learn to do some new things. And so please bear with us. We're trying to do what's best for the community. And if this passes, please understand, it doesn't mean that we can't ever tweak it, that we can't ever change it, that we can't make adjustments if they're necessary. I think our staff, I think our city attorney has done a good job of drafting something that appears workable. But again, there will likely need to be some kinks worked out. I'll make a motion to approve what Carol's prepared.
I'll second it under the contingent that we will modify it.
Okay. So that's what I think we do, is a motion and a second, we'll vote. Now there's any other discussion, so this is the point where you would, if you have modifications to any part of that, that would be discussed at this point. Is that right, Carol?
Yes, and I think Commissioner Allen has something to say.
Well, I just want to, I've seen different versions of this, and I hadn't seen, because I've been busy today, I work. If I vote for the proposal, that means I want masks. If I vote against the proposal, that means I don't want masks. So if I say nay, is that correct?
Yes.
Yes. And just to briefly explain quickly, Carol, unless you would like to do it, the mask policy only applies indoors, for people indoors. It doesn't apply outdoors as it's written. It also excludes hospitals and schools because they're going to have their own policies. And then there's a bunch of exemptions. And Carol, you read those exemptions off.
Yeah.
Children under 5 years of age.
I'd like to modify that one.
Okay.
Children under 2.
Well,
because that's what the CDC says.
Okay. Is there a second to children under 2?
Well, there's a motion and a second already on the floor.
I will modify my motion along Jonathan's lines.
Okay. Okay, I'll read through the rest. Persons for whom a mask would impair an existing health condition, persons communicating with a person with a disability when a mask would impede the disabled person's understanding, persons with a disability that makes masks impractical, persons who are maintaining social distancing, persons in their own homes, the homes of companions or family members.
Carol, can you go back 2, please, and read that one more time?
Yes. 2, Okay, persons communicating with persons with a disability.
One more.
Okay, persons with a disability that makes masks impractical.
Okay, and keep going, please.
Okay. If you are maintaining social distancing, you don't have to wear a mask.
So if you're maintaining
Right.
social distancing, you don't have to wear a mask.
Exactly.
Okay.
It's social distancing or masking.
Or a mask.
Then, in your own homes, the homes of your companions or family members, you know, those people that, you know, you're close to, and you know what I'm saying. Okay, in their homes, it doesn't apply. It doesn't apply when you are receiving personal care that requires a mask not be worn. So, when you are at a dentist's office, or you're getting, you know, a facial or something involving your face, obviously, you can't wear a mask. Okay. Persons exercising or engaging in sports while maintaining social distancing and where proper measures are in place for sanitizing surfaces, and this is inside a building. So we're not talking about outside. No one is saying you can't walk around and stuff like that. This is you would wear a mask while engaging in exercising where you're not maintaining social distancing. That's the only time. Okay, public safety personnel, because they have to do those emergency things. You know, so there would be times when, you know, they've got to save someone and they can't be fiddling with a mask. Okay, persons whose occupations does not allow the wearing of a mask. Maybe welders, I don't know. Some of these are other people's suggestions. So if your occupation does not allow the wearing of a mask, then you don't have to wear it. Persons who are eating or drinking while maintaining social distance other than with their family members or companions. So if you're in that same group, like the group that you sit in the pew at church with, you can sit close to them, and as long as they're socially distancing with other people, you don't have to wear a mask while eating, I guess, at a restaurant. Because there's no rules about eating in your home. Okay, and these are all collected from like 6 different cities. And we didn't take all of them, and we just blended them. Okay, so I think you want to reduce it to 2 years old.
Never mind.
No? No. So,
It's a contentious point. Most people in the position to do that aren't going to put them out.
okay, so, yes?
May I say this? From what it sounds like, there is no change to what we already have in place. I mean, really, I don't see where's the change.
The penalty, Derwin, there's no penalty for what we have in place now. I mean, that's really the fundamental problem, is that we've been advising this, the CDC's been advising this, the governor's been advising it, and as a practical matter, no one's been complying, or at least not a significant enough portion of the population has been complying to provide the public safety that we need to protect each other. And as people have not been complying in adequate numbers on their own, I think that, I mean, that's part of what's driving this is, well, listen, everybody's not doing their own, we got to try something. And the next thing we have available to us is to try to put some teeth into it.
And Commissioner, I want to bring out a point. Reason why I'm saying this, because I don't want it to come back on the city. And individuals say, well, you know, they're discriminating against certain ones. You know, we can't police it. We can't police everything. The chief of police said we can't do it. And he's right. It's humanly impossible. We're going to have to be independently responsible ourselves. But from the declaration that we already have set in order, there's really no change. There is no change to it. And if it is, someone help me other than penalization. And if you penalize some, you know what I mean? I mean, you all get what I'm saying? I mean, I mean, there's really no change there.
Church, I gotta wear a mask, is what you're saying, right?
No.
It's indoors. Yes.
With the social distancing, with the social distancing, with the 2-foot spread in between each.
Revival breaks out and the church fills up that day.
But what we have in order now, what we have in order now.
There's no requirement to practice social distancing in churches.
Where's that?
Just to clarify, and Carol, you can help me.
I mean, we can tour around on Sunday.
And define social distancing.
According to the CDC, it's 6 feet per each of them.
Yeah.
Hey, just to be clear here, just for everybody, Commissioner Norwood, we are following, the action that the city is taking now is we're following the governor's plan. The governor's plan does not mandate masks but it does suggest social, okay. And it suggests social distancing. So I just wanted that to be clear where this is different, even though there's a lot of exceptions she read off and that it's indoors. The difference is that it's requiring people to do it. And as Commissioner Ezell said, there is a fine specifically. It will be difficult to enforce. That's true.
But let's not get too hung up on it being difficult to enforce because, I mean, as a practical matter, like 23 states are doing this. Even Texas is enforcing it. The entire state of Texas is getting fined for this.
Ben, I was in Texas the last 2 days, like I mentioned, and they have a sign on the door on every restaurant that you must have a mask to come in. As soon as you walk in, you can take it off. And then every retail store we were in, each one of them told us, hey, we don't care if you take it off if we don't. So they're not enforcing that in any way, shape, or form.
So why bother?
They should be.
They're not.
No.
But we could be better than Texas, David.
I was in Texas as well a couple weeks ago, and when you go inside, and might have been on a different side of town. My kids live in North Dallas, but when we went in, if we left out of our car, we had to make sure we had our mask on by the time we went in that business to follow their rules. If you're church people, you're Christians, you follow rules. If it say no shoes, no shirt, no service, you followed that rule. And in Texas, where I went to eat, it said no mask.
How about Shadrach, Meshach, and Abednego? They didn't bow.
I can guarantee you, y'all wouldn't have, you're not living, I shouldn't say how you live,
but they willingly went into the fire.
But anyway, I followed the instructions in Dallas, what they said. And I mean, as Christians, don't we follow rules? No, you don't? Okay.
They got a discount.
There he goes.
Yeah.
Let's call the question, Mayor.
Let's call for the vote.
Call for the vote.
Call for the motion.
Okay.
Do the roll call.
We had a
But
call.
then God did say, if his word if he had to go by God's rule, this is about choice. It's about freedom. Think about that. This is the land of the free and the home of the brave. So I choose to be free. So I have
Romans 13 says you have to obey the laws of the land. If you don't follow the laws of the land.
Let's have a vote.
Hitler says, turn in your Jewish neighbor. Are you going to follow that?
Hang on now here.
All right. We have a motion and we have a second, I believe. Any other discussion from the panel?
So, to make clear, the motion is to accept the order to require mask.
It's written with the exceptions as written. Okay, so we have a motion and a second. Any other discussion?
And it's been a long night. We need to not use our board because
Right.
we're Zooming.
Right.
So
So we'll do a
Roll call.
roll call. Okay. Go ahead and take the roll.
Okay, Commissioner Allen,
Nay.
Commissioner Norwood,
Nay.
Commissioner Ezell,
Aye.
Commissioner Waddell,
Aye.
Commissioner Stallings,
Aye.
Commissioner Mason,
Nay.
Mayor Pankinen,
Nay. Okay, motion carries 5. I'm sorry,
Yeah.
motion failed, 5-2.
Motion to adjourn.
Second. Motion and a second, all in favor? Okay, any opposed?